Good evening, everyone. Welcome to the presentation of Pathaya National Seminar, a new platform with great pleasure. This National Seminar presentation is an amalgamation of various topics. There's a lots of knowledge that we know and don't know in our Ayurvedic science. This Pathaya National Seminar presentation is to bring this knowledge to everyone in a short period of time and to enable everyone to speak for the growth of Ayurvedic science. We would like to thank Dr. Lakshmi and Dr. Divya, who led from the front in making this presentation possible, as well as all the talented people on each panel who sacrificed their time for us despite the busy schedule. At the beginning of the Pathaya National Seminar, I would like to invite our paper presentation coordinator, Dr. Aishwarya RS. Hello, Dr. Aishwarya. Please unmute, Doctor.
Thank you, Dr. Hello, and welcome to our Pathaya National Seminar, paper and presentation by Priyanka. Thank you all and your participation not only valuable but necessary in the designing of an excellent data. Now, with great honor, I would like to invite our respected panel members. First of all, I would like to invite our Agadandra panel members, Dr. Ashwini S., Dr. Prasad, and Dr. Khalitya. Next, I would like to invite Panchakarma panel, Dr. Mohan Kumar, Dr. Anjana Mishra, and Dr. Mahesh Raj. Next, I invite Dravyaguna panel, Dr. Sharma, Dr. Devi, and Dr. Pooja. Next, I invite Kaumarapya panel, Dr. Pankaj Verma, Dr. Ramya, and Dr. Ansiba. And next, let me invite Samhita panel, Dr. Veena Vijayan, Dr. Rashmi, and Dr. Yasi. Next, I invite Dana panel, Dr. Adarsh Arora, Dr. Nitya R, and Dr. Arya K. And now I invite Surve panel, Priya, Kavita, and Dr. Next, I invite Vatsanabh panel, Dr. Vandana Sharma, and Dr. Now, let me invite Kayajilta panel, Dr. Deshpande, Dr. Vinita S, and Dr. Surya Chetak. Now, I invite Manasika panel, Dr. Nidin Darade, and Dr. Uma Jadhav. Next, I would like to invite Shalidatra panel, Dr. Sandeep Pandey, Dr. Ravinder Singh, and Dr. Vaishnav. I invite our Rasab Vaishya panel, Dr. Arulal K, and Dr. Priyanka. Let me invite Chalakya Tantra panel, Dr. Akanksha K, Dr. Devika Pradap, and Dr. Now I invite our physiology panel, Dr. Kiran Kumar T, and Dr. Ramya. And finally, I would like to invite our anatomy panel, Dr. Ramya Bhushan, and Dr. Prabhaji. And without much delay, let's get started. And with that, let me remind you Dear participants, the allotted time station it kindly follow the time limit. The webinar is streaming live on YouTube, and the copy will broadcast websites and necessary. So we can start with our first presentation. First, we have a paper presentation, and I invite Dr. Niloy presentation. Dr. Niloy.
Yes, ma'am. Good evening.
Good evening, doctor.
Yes.
Please share the screen, doctor.
Yeah. Just a second.
Your screen is visible, doctor. Please start.
Good evening, sir. Good evening to each of the panel members, educator teachers. I am now presenting Snuhi, U4 BSc, Tukaram. In Ayurveda, it is considered as Sthavar Vish. Also, it is considered under Upavish section. According to modern medicine, irritant organic plant poison. So, general description about Snuhi. It's a large, much branched shrub, fleshy green and jointed with 3-5 wings. Yes, sir. Are you? I am audible, sir.
Yes, doctor. Audible, doctor. Please
Yeah.
continue.
Branches rounded, circular with spines. Milky juice is secreted through it. That is the main. The latex is the main ingredient of Snuhi. Snuhi is a strong poison. Leaves are small, converted into spines. Flowers in rains. It flowered cymes with central flower. The Sanskrit name is Snuhi. Hindi name is Tuhara. English name is Kamal Milk Hedge. In Telugu is called as Akuji Mudu. Toxic parts is milky acrid juice or the latex of the plant. The main toxic principles are euphorbion. Fatal dose is actually uncertain, but in some parts we have found that a possible fatal dose is 25 to 30 ml of the latex, and fatal period is about 3 days. Although it's uncertain, but in some texts they have mentioned it like that. The Snuhi sheet, after proper shodhan, can be used as a medicines also. Toxic signs and symptoms: route of poisoning through skin, gastrointestinal poisoning. If juice is applied to skin, it leads to vesication. If instilled to the eyes, leads to severe conjunctivitis and loss of eyesight. If taken internally, symptoms include vomiting, diarrhea, convulsions, and coma. Now the treatment part, sir. According to Ayurveda, if externally applied, application of tamarind macerated in water helps. Internally, cold water with sugar, buffalo's milk with sugar, or Moktik Yukta Kamadudha helps. Proper. Also, sir, if the dose is high, gastric lavage with normal saline activated charcoal helps. Topically, we can apply, according to modern, we can apply corticosteroids. And, if applied in eye, we can use antibiotic eye drops. Now the postmortem findings. Signs of inflammation of the contact pad, gangrenous patches in the stomach and rotten spleen are the main symptoms. Medical legal importance. Juice is used for criminal abortion, homicide rarely. Juice is applied to the eyes and the genitals for punishment for adultery. Homicidal and suicidal purposes are very rare and used for procuring criminal abortions. Conclusion: poisonous plants which are included in Visha and Upvisha category can give quick relief in the various diseases. One thing I want to add, the Snuhi Kshir Shodhana. In some texts, we have found that 2 pal of Snuhi Kshir taken along with 2 tola of filtered Sinca plant, Patra Soras, that is tamarind plant, in a clean, wide mouth container. The vessel is placed under sun and dried, and this dried up powder is stored and later used at Shuddha Shushka Snuhi Kshir for further therapeutic uses. With this, I will end my presentation, sir. Thank you to all.
Thank you, Doctor.
Thank you, sir.
Next, I invite Dr. Gajanan Shripad Kulkarni for the paper presentation on the topic role of Ayurveda in mental health. Hello, Dr. Gajanan Shripad Kulkarni, are you there?
Yes, sir. I'm
Okay.
I'm present.
Okay,
Am
Doctor.
I audible, sir?
Yes, Doctor. Audible, Doctor.
Okay.
Please share the screen, Doctor.
One second. Actually, I'm unable to share my screen. Hello.
Okay, Doctor. 1 minute, Doctor. I will share for you, Doctor.
Yes, thank you, please.
Doctor, please share, Doctor.
Yes, thank you, sir. Good evening, all my friends and respected panel members. Today, I am presenting my power presentation of role of Ayurveda in mental health. As all we know, what is Ayurveda? Then further, I will tell mental health is one of the 8 divisions of Ayurveda, the 4 components of life. Next. Okay. The philosophy of creation of intelligence in human beings. According to Ayurveda, the source of all existence is universal cosmic consciousness. Purusha is male energy, while as Prakriti is female energy. Creation of whole universe happens through their love. Prakriti is a divine mother of all nature. Next. Okay. Now we will discuss about qualities of mind. Sattva, that is equilibrium. Equilibrium is responsible for knowledge, acquisition, and reasoning. Rajas, activity, is the initiator and provides the essentials for initiation of thought. Inertia, that is tamas, that is tamasic gun, provides a calming, soothing effect, and a normal stage becomes the brake which controls the overactive rajas and reasoning sattva. The balance of these 3 is essential for a healthy state of mind. When this balance is lost totally, we have a mental disorder. Next, please. Okay. What is the state of mind? The ideal state of mind is sattvic. Rajas is the active force behind the movement of both sensory and motor organs. Tamasic gun gives rise to 5 elements which form the basis of material creation. Ayurveda also says that negative feelings are emotional toxins. If they are not taken out of the body in a proper way and time, they give rise to chronic mental disorders like anxiety, neurosis, and depression. Next. Now, psychological conditions. Psychological conditions caused purely by mental disorders are kama, lust, krodha, anger, lobh, greed, moha, delusions, irsha, jealousy, shok, sorrow, chinta, anxiety, bhaya, fear, harsha, overexcitement. The psychiatric conditions caused by a combination of physical and mental disorders are psychosis, illusions, drowsiness, alcoholism. Next. In the manifestation of nature from female energy, that is Prakriti, the first expression is intelligence of cosmic order, Mahat. In human beings, it is referred as intelligence, that is Buddhi. Next is ego, Ahankar, the sense of self-identity, the center in our consciousness from which we think, act, and react. The mind is functionally divided into ego, will, and intellect. That is Ahankar, Ichha, and Buddhi. Desire is directed by ego, controls the mind. The intellect takes the decisions. Next. According to doshas, we will see symptoms of mental disorders. Three doshas are the principle in our body, which creates our specific mental and physical characteristics. Vata's symptoms are insomnia, anger, fearfulness, mood, swings, insanity, schizophrenia. Pitta's symptoms are anger, blaming others, aggravation, always fightful. Kapha symptoms are daydream or sleep, excess sleep, low motivation, always dependent. Next. Now we are coming to treatment for mental illnesses. It includes psychotherapy using drugs, diet, and lifestyle management. It includes three methods. That is, first is Daivapashray. That is, psychobehavioral therapy includes chanting of mantras, performances of various homes, fasting, controlling tamas and rajas activities of the mind, establishing a sattva predominant state, which is essential for normal and healthy functioning of the mind. Second is sattva vajay. That is, it involves efforts to control the abnormal mental activity by practice of yama. That is, code of conduct, niyama, strict behavioral regimen, asana, various yogic postures, which are helpful in imparting stability to both mind and both body and mind. And lastly, pranayam, which blockages the causes of disease, and dhyan. Third one is yukti vyapashraya. This modality involves the judicious use of medicines and diet. It is broadly classified into two groups, namely Shodhan and Shaman. Next. Okay, now we will see Ayurvedic preventive approach. Ayurveda treats individuals according to their unique physical constitution, indicated by the combination of three doshas, along with the mental, social, and environmental conditions that affect them. Ayurveda focuses on prevention of illness, promotion of health, and longevity, for which Charak and Susruta recommended a lifestyle consisting of Dinacharya and Rutucharya, involving diet, exercise, meditation, and virtuous quality. Though Ayurveda is essential preventive in approach, it has a comprehensive system of curative medicine. Charak Samhita's formula involves purification, pacification, and remove the cause, that is Panchakarma therapy. Now we'll see remedies. Lifestyle management is the important part in the healthy mind, which includes rising early in the morning, practicing yoga postures, breathing exercises, and meditation. An oil head massage calms and nourishes the mind. For example, oils of sandalwood, sesame, coconut, etc. A few drops of medicated ghee are placed in the nostrils to soothe mental activities. Medicated enemas are also used for Vataja doshas. Aromatherapy, nowadays it is very famous. Aromatherapy like incense or oils of sandalwood, camphor, and cedar cleanse the psychic environment. Rose and lotus calm and nourish the heart. Jasmine cleanses the emotions and increases love and compassion. Next. There are few Ayurvedic medicines for mental health. There are herbs in Ayurveda to promote the intellect and deeply nourish the neurological tissues. They are nervine tonics. The Medhya Rasayan enhances biological nourishment of the brain, producing tranquility of mind, concentration, and improved memory. For example, Ashwagandha, Shankapushpi, Brahmi. Hello. Almond is a very good mental tonic. Next. Thank you. Thank you very much, sir.
Doctor,
Thank you, doctor.
Yes.
good. Possible. Next, I invite Prashant.
Yes, ma'am. I'm present, ma'am.
Just
Okay, doctor. Please share the screen, doctor.
Yes, yes.
The presentation topic is Vatsanabh.
Oh, what's enough? One sec, sir. I'll share my screen. Share.
Hello, Dr. Prashant.
Ha, sir.
You have any problem with screen sharing, doctor?
Yes, sir. There is some problem, sir. I'm not fine. One sec. Can you share?
Okay, okay, doctor. I will share for you, doctor. I will share for you.
Yes,
Okay.
yes, please, sir.
Okay, doctor. Please start the session, doctor.
Yes, thank you, sir. Thank you. Good evening, all my friends and all the panel members. I'm going to present the today. I'm going to present the topic called the Vatsanabh. The Latin name of Vatsanabh is Aconitum nepalus. Also, we can also it is called as Aconitum ferox. Next, the family, it comes from the family Ranunculaceae. Next, sir. The Vatsanabh classification of the Vatsanabh according to Ayurveda, it comes from the Mahavisha. Also, it is from the Powar Visha. According to modern science, it is a cardiac poison, and according to modern science, it also a irritant organic plant poison. Please next, sir. General description of Vatsanabh: it is a shrub of height 2 to 6 feet. This shrub is annual. Leaves are dark green in color, similar to Nirgundi. Flowers are blue colored with erect terminal spikes of helmet shape. That's why it is called as a monk's food. The toxic parts of the plant are all the parts of the plant are toxic, but the root is commonly used for the commonly used as a toxic part. Next. The dry root is conical, tapering, swelled with longitudinal wrinkles. It is 5 to 10 centimeter long, 1 to 10 centimeter thick of upper extremity, externally dark brown colored. When it is freshly cut, the color is whitish. With the exposure to the air, it turns in the pink in the color. The taste of root is sweetish, hence it is called as a mithavish. The root of aconitum may be confused with the horseradish. Next. Toxic principles of the Vatsanabh are aconitum, aconitin, picracontin, pseudoacontin, and aconine. Next. The mechanism of action of Vatsanabh: first, it stimulates and then depresses the myocardium, smooth muscles, skeletal muscles, central nervous system, and peripheral nerves. Next. The fatal dose for if the root is used is 1 gram, aconitin 4 milligrams, juice of leaves and flowers 250 milli, extract of root 5 milli. approximately 25 drops. Fetal period up to 6 hours. Toxic signs and symptoms. Route of poisoning is through skin and gastrointestinal route. Locally, if leaves and flowers are handled or rubbed, sensation of tingling and numbness occur on hand. Due to pollen grains, there is a pain and swelling in eyes. Internally, if aconite is ingested in any form, it produces symptoms of tingling and numbness within few seconds. These symptoms are first on lips, mouth, tongue, and throat. Later, salivation, nausea, vomiting, pain in abdomen, and sometimes diarrhea. The tingling and numbness then spreads all over the body, followed by profuse sweating and impending paralysis, diplopia, blurred speech, muscular weakness in limbs. Blood pressure falls in early stages. Respiration is rapid but becomes slow. Dyspnea. Skin becomes cold and clammy with hypothermia. Hallucination and death is mostly due to asphyxia or syncope. Hiccups reaction. In aconite poisoning, there is the alternate contraction and dilatation of pupils. In early stages, hiccup sign is seen, but later stages, pupils get dilated. Next. Treatment according to modern science, gastric lavage with lukewarm water and weak solution of iodine in potassium iodide or tannic acid. Use of activated charcoal or oxygenation, atropine 1 gram to prevent vagal inhibition. For cardiac arrhythmia, give 50 ml of 0.1% Novocaine slowly. For collapse, give IV fluids. According to Ayurveda, the treatment is Tankan is the antidote of aconite. It is given in cow's ghee. Sheep's milk is used as an emetic agent. It should given till it remains in the patient's stomach. Powder of Arjuna bark, that is terminated as Arjuna, along with the ghee and honey. Next. Postmortem findings. No specific postmortem findings are found in Vatsanabh poisoning, but traces of root pieces may be found in stomach. Aconite is highly unstable and may not be detected in chemical analysis. Next. Medical legal importance is accidental poisoning mistaken for horseradish which is edible. Homicidal or suicidal poisoning through, though noted, are rare. In homicidal, it is mixed in the form of tincture or root powder with the betel leaf, as an arrow poisoning, cattle poisoning. Next. Next, sir. Yes, thank you, sir. Thank you.
Okay, thank you, doctor.
Thank you.
Doctor. Next.
Yes, yes, ma'am.
Next, I invite Dr. R. Right, Dr.
Hello, Dr. Karishma, are you there? I would like to invite Dr. Karishma on the topic Introduction to Nikhandus. Dr. Karishma, are you there? Hello, Dr. Karishma, are you there? Okay, next I invite Dr. Prajna Bhat for the paper presentation. Dr. Prajna Bhat, are you there?
Hello. Am I
Hello,
audible?
Yes, doctor, audible, doctor.
Okay, I'll share my presentation just a minute.
Okay, doctor.
Can you share it for me? Hello.
Okay, doctor, I will share for you, doctor.
Thank you.
1 second, doctor.
Sure.
Doctor, please start the session, doctor.
Sure. Good evening, everyone. The topic of today's presentation is decoding the code Udakamehinam Parijata Kashayam Payit. As we know, in Sushruta, Prameha Chikitsa, for each of the type of Prameha, a specific combination has been told. So why that combination has been told and what more can we understand from the given combination is what we are going to understand today. Next slide, please. To understand any treatment regarding a disease, first we should know what the disease is about. As told in different samhitas, there is a collection of the samprapti told here. Bastem ashritya kurute pramehan dushitah kapah dushaitva vapukleda svedamedo rasamisham. So as we know, the dosha is here, shleshma dosha vishesha, and the dosha, as we know, is bahuvabadda. In Charaka, the detailed samprapti has been told as the first step being Shipram Shleshma Prakopamapadyade. That is, the Shleshma gets Prakupita. Then it spreads all over the Sharira. Shiprameva Sharire Vistriptam Lavate. Then it goes and mixes with Medas. Medasa Aditaha Mishri Bhavam Gachati. Then it does Dushana of Medas. Saha Medasa Mishri Bhavan Dushayati Enat. Then Sharira Kleda Mamsabhyam Samsargam Gachati. It goes and mixes with Sharira Kleda Mamsa, etc. Then Mamsa Pradoshat, Mamsa Pidaka, Puti Mamsa Pidaka, Sharavika Kachapatya, Sanjayanati. When this dosha combination goes to Mamsa, it develops into Mamsa Pidaka, etc. And then it enters into Mutraha Srotas and Guruni Mukhani Asadya Pratirudyate. It blocks the Guru Mukha of the Srotas and hence Prameha is caused. Next slide, please. The overview of the Samprapti can be seen as based on the Nidana, the dosha Vishesha happens, that is, the dosha gets Dushita, and it does Dushana of Medas, Sveda, Kleda, Rasa, Rakta. It enters into Mutravasrotas and causes the blockage there. The Nirbhedana occurs at the Mukha of Pasti and it leads to Prameha. Next slide. As we know, each disease has a specific symptom related to that disease, and in Prameha, it is. Next slide, please. Tatra avila prabhuta mutra lakshanaha sarva eva pramehaha bhavanti. In all the Prameha, avilatva and prabhuta mutrata are the major lakshana which are specific to Prameha. Next slide. What is Udakameha? The references that we get is Kaphat. It occurs due to mainly Kapha dosha. It is one of the Dasha Kapha Meha, and Shvetam Avedanam Udaka Sadrisham Udakamehi Mehati. It is Shweta and it looks like Udaka, it looks like water. Next slide. And it doesn't cause any pain, it is Avedana. So to understand the Parijata Kashaya and Udakameha, we have to understand the Gunakarma of Parijata. The properties are Tiktarasa, Laghuruksha Guna, Ushnavirya, Katu Vipaka, and the Doshakpata is Kaphavata Shamaka. So the Prameha is also having Kapha dosha as a main dosha kartra here, and Parijata is Kaphavata Shamaka. Next slide. On understanding the action of Tiktarasa, as told in Ashtanga Hridaya Sutra Sthana Rasabhediya Adhyaya, we can understand that Kleda Meto Vasamaja Shakrin Mutra Pashoshanaha, it does Shoshana of Kleda, Medas, and Mutra, all of which are contributing factors in Prameha. It is Ruksha and thus helps to decrease the Kledatva of the Pramehi. Next slide. The Laghu Ruksha Guna of Parijata help to reduce the Bahudravatva of Shleshma, which is the main dosha here in Prameha. Next slide, please. Then if we understand the chemical constituents of Parijata, there are three main constituents present: D-mannitol, tannin, and linoleic acid. Mannitol is an organic compound. It is used clinically to reduce acutely raised intracranial pressure and used as an osmotic diuretic agent and a weak renal vasodilator. Tannins are astringent, bitter plant polyphenols that either bind and precipitate or shrink proteins and various other organic compounds, including amino acids and alkaloids. Linoleic acid is an unsaturated omega-6 fatty acid. It is colorless liquid and is beneficial in cystic fibrosis, cancer prevention, dermatitis, and diabetes. Next slide, please. It is observed that leaves are mostly used for medicinal purposes in comparison to other parts of the plant. On chemical and phytochemical analysis, it is found that the plant contains many active principles as well as different biomarkers. Multi-active ingredients present in different parts of the plant may be the cause of its broad spectrum therapeutic use. Next slide. Why Kashaya? As we know, that which does Karshana of Roga, that is reduces the Roga, is called Kashaya. Kantasya Kashana Prayo Roga Nam Chapi Karshana. All the constituents of the Dravya get into the Kashaya on the process of boiling it. Next slide. How to administer fresh Kashaya is the best as the potency is more. The dose should be decided based on the intensity of dosha and dosha in the rogi. Administering it before food is best for Prameha in the stage where Mutra Brahasotras is involved because it then acts directly on the Pana. And when taken along with food in Samana Kala, it will directly act upon the formation of the Vikrita dosha and help to reduce the Samprapti at that level. Next slide. How to know that what can we see as the effect of Parijata Kashaya in Udakameha? Reduced frequency in the urination, reduced Travatva of the Kapha, and Stiratva in Vedas. Next slide. How to know when to stop? As told in Sushruta Samhita, Praminoho yada mutram apichilam anavilam vishadam tikta katukam tadarogyam prajakshate. When the mutra becomes apichila and anavila, that is completely clear, and vishada, the rasa becomes tikta katuka, then we can understand that the samprapti is being reduced. Next slide. Conclusion. Giving medication is just a part of the treatment. The other part includes observing patient every moment. Avaidya must know when to stop the treatment or change the dose or change the treatment methodologically. This can be known with proper nidana and samprapti mapping of the disease. Thank you.
Thank you, Doctor. Next, I invite Dr. Karishma Shivaji Surve for the paper presentation on the topic Conceptual Study of the Pathophysiology of Khalitya and Use of Bringraj in Khalitya. Dr. Karishma
Good evening, everyone. Am I audible?
Audible, Doctor. Please share the screen, Doctor.
Yes. Wait a minute.
Okay, Doctor.
Hello, sir. Can you please share for me?
Okay, Doctor. I will share for you, Doctor. 1 second.
Yes, sir.
Okay, Dr. Karishma, please start, Doctor.
Yeah. Good evening, everyone. My today's topic is conceptual study of pathophysiology of Khalitya and use of Bringraj in Khalitya. Next slide, sir, please. Next one. Okay, we will start with the introduction. Hair is derived from the ectoderm of the skin, and it is a protective layer of the skin. Losing a 70 to 100 hairs per day is very common, but more than 100 is considered as a hair fall. And from the surveys, we have come to know more than 40% males and 25% females are suffering from the hair fall. In Ayurveda Samhitas, different methods are explained to stop the hair falls, like a leash therapy, local application of oil, gritha, nasya, and etc. With the help of the previously made preparations like a Bringraj, using a drugs like a Bringraj, Brahmi, Amalki, Jatamansi, and etc. Next, sir. Our main aim is to understand the pathophysiology of Khalitya, and second is to understand the effect of Bringraj in a hair fall and study its pharmacology. Next slide. Literature review. The Vedas are the large body of the religious text originated in ancient India, composed in a Vedic Sanskrit. The text constitutes the oldest layer of the Vedas. It considered as the oldest authentic manuscripts ever found. The detailed explanation about the Khalitya is available in every Samhita. In a Charak Samhita, in Charak Chikitsa Sthan, it is explained. In a Shushrut Samhita, in Uttar Tantra, Adhyay number 1, stroke number 25, in also a Nidan Sthan, we get the references. Bhagavadacharya also explained the detail about the treatment of the Khalitya in Uttar Sthan, in Adhyay Shiroroga Adhyay. Harit Samhita has explained the pathology of the Shiroroga in Adhyay 28, Adhyay Shiroroga Adhyay, shlok number 28 and 29. Next, sir. Material and methodology. The paper is based on Ayurvedic text and previously published articles and research papers. Ayurvedic text includes Charak Samhita, Shushrut Samhita, Bhagavad Samhita, that is the Sartha Bhagavad, Harit Samhita, and other Ayurvedic textbooks. The information is also collected from the previously released journals and articles. Next, sir. Descriptions. Ayurveda has accepted the different types of concepts like Siddhantas, Dosh, Dhatu, Mala, Srotas, Kosh, Agni, and etc. In Ayurveda, 7 Dhatus are explained: Rasa, Rakta, Mausa, Medha, Asthi, Majja, and Shukra. Each Dhatu is formed by the Sar part of the previous Dhatu by Dhatu Poshan Nyay, Siddhanta. In this procedure, the new Dhatu is formed. Not only the new dhatu is formed, but also the upadhatu and mala are also formed as a byproduct of this dhatu production process. Kesha, that is hairs, are also produced in the same way as a mala of the asti dhatu. When pak of asti dhatu occurs by its own dhatuvagni to form the majja dhatu, during this process, as a mala, kesh are produced. So if there is any abnormality in asti dhatuvagni or asti dhatu poshan, it affects and alters the process and of production and strength of the hairs. Next, sir. Samprapti. Hetus are the Ati Lavana, Kshara Ahar 7, Ati Tikshna, Ushna, Pitta Prakopak Ahar 7, Vishamashan, Viruddhashan, stress, hormonal changes, or hormonal imbalance, hereditary or genetic factors can affect the hair strength. Samprapti. Due to the pitta and vata prakopak ahar vihar, bhrajak pitta, which is present at the base of the hair follicle, that is at a roma kupa, along with the prakopit vat, causes a hair fall. At the same time, when prakopit kapha and rakta causes the occlusion of a hair follicle, and the further growth of hairs is stopped. This develops a khalitya, that is a baldness. Ayurvedic management. Nowadays, there are many therapies are available like a hair transplant treatment for the hair fall, but these comes in a picture after major loss of hair, where the Ayurveda is the only pathy which can give effective results to stop the hair falling of the hair and promotes the hair growth. There are different methods like Nasya, Abhyanga, Lep. First comes a Rasayan Kalpana. It prevents ways to stop a hair fall. For example, Amelki Rasayan, which can be used internally to stop the hair fall. Second is Abhyantar Aushadhi Sevan, different quathas, kalkas, or gritas prepared by the Ayurvedic drugs like a Brahmi, Amalki, Bringraj are used for the Abhyantar Aushadhi Sevan. Local application of Siddha telas and gritas are used to apply on a scalp and hair roots and also a length of the hairs to stop hair falls. Nasya. As we all know, the Nasa is Shirosudwaram. Nasya is considered as a main treatment for a Shirorogas, and it is also effective in a Khalitya. Leech therapy, it is a method of detoxification of a local blood supply of hair follicles. This process improves the blood supply to hair roots and promotes the hair growth. Next slide, sir. So we come to a Bringraj, which is considered as a main drug for the hair fall. Its Latin name is Eclipta albahas. It belongs to the family ** and is commonly known as a Bringraj. A number of preparations are made with the hair with this, and different type of hair problems are solved. The synonyms of Bringraj are Marga, Bring, Kesha, Kesharanjana, Suryavarta, and Karanja. There are mainly three types are available: Shweta, Pitta, and Nila. Also, there is a one more type, that's Krishna, but it is only explained in a Adarsha Samhita. Next slide, sir. Here are the some synonyms, or we can say different language names for the same Bringraj. In Sanskrit, it is called as a Bringraj. In Hindi, it is Barbie. In English, the trailing eclipta. In Marathi, it is called Maka. Tamil, it is called Kaikeshi. And Telugu, it is called Gunta Lijuru. Pharmacodynamics, its rasa is Katu, Tikta, Virya is Katu, Vipak is Ushna, Guna, Lakhu, and Ruksha. Its Upayuktanga is all the Panchangas along with the beach can be used for the treatment. Its Toshagnata is mainly a Vatagna and Kafagna. Rogagnata, along with the used in Khalitya, it is also effective in Pandu, Shwas, Raktapitta, Amlapitta, Shiroroga, Jwara, Hridrog, Khalitya, and Palitya. Next slide. These are the phytoconstituent of the Bringraj. Alkaloids, terpenoids, and other glycosides. Sterolol, flavonoids, fatty alcohols, and the volatile oils are the main constituent. These all are effective in hair growth. Rather than a hair fall, they promotes the growth of the hair and reduces the time required for the total hair growth. Okay, next slide, sir. Next slide. Here are the some formulations of the Bringraj which are mainly used as a treatment of a Khalitya. First is Bringraj oil. We get the detailed reference and the contents in a Charak Samhita, Adhyay number 9 and Shlok number 61. Others are the Shadbindu Tel. Shadbindu Tel is most probably used as a nasya, which also which can prevent not only the hair fall but also other Shira Rogas. So it can consider as rasayan for the hair fall also. Then other are Charadi Tel, Mahanila Tel, Bringraj Krit, Trifaladi Lep, Nimba Beach Tel, Gunjati Tel, and Chandanadi Tel. Next slide, sir. Discussion. Bringraj is indicated for falling of hairs, graying of hairs, and hair quality problems. There are a lot of references in Ayurvedic granthas to prove its hair growing property and activity. Many preparations are given in a different granthas. A modern study is also conducted to prove the activity of Bringraj in a hair growth. Roy LL proved the hair growing activity by using the ethanol and petroleum, their extract of the E. albicans, albino rats. The oleaginous cream is prepared with the extract applied externally on the denuded skin of the albino rats. The extract demonstrated significant reduction in a hair growth time by half. The another study is conducted to prove the hair growth property of Bringraj is polyherbal formulation containing the Bringraj, Jatamounsi, and hibiscus. It exhibits a significant hair growth property by no rats. The time taken for the total hair growth were considerably reduced. Next slide. Conclusion. Ayurvedic Samhitas and a modern science both have proven and accepted the anti-hair fall, anti-hair graying effect of the Bringraj. The phytoconstituents of the epileptic alba is responsible for the hair growth, so it can be used safely for hair promoting activities. Next slides. Here are some references for the total description. Next, sir. Okay. Thank you so much.
Thank you, doctor. Next, I invite Dr.
Thank you.
Nivrutti Powar for the paper presentation on the topic Dinacharya. Dr. Vinod, are you there?
Yes, sir. I'm here.
Okay, doctor.
Is I
Please
am
share the
audible?
screen. Audible, doctor. Please share the screen, doctor.
Okay, sir. Sorry to share screen. Would you please share the screen?
Okay, doctor. 1 minute, doctor.
Okay.
Dr. Vinod, please start.
Okay. Good evening to all panelists and all my colleagues. My topic is Dinacharya. Dinacharya is related to Swastha Vritta. In Ayurveda, various acharya describes how to spend whole day to stay swasth, because we know swasthasya swastha rakshanam. So there are some vidhis which acharya said in detail how to spend. The first one is utthana. Utthana means Brahme Muhurt or pre-dawn. You should be wake up from the sleep. It helps proper digestion or of previous dinner. Next, after utthana, next vidhi is ushappan, means taking water. 1 to 2 liters of water stored in copper utensils. Use water through nostrils, intelligence, and eyesight. Next vidhi is soch, means defecation. Now, in this phase, how to spend soch, this is described. Face on north direction, shouldn't speak, shouldn't remain black neck, cover up head, neither suppress or nor initiate the urge, wash and clean the anal region, wash the hand, legs properly. Next is the Danta Dhawan, means to brush twice daily, morning and before going to bed. Toothbrush in Ayurveda, 12 anguls tongue cleaner use, and drugs Karanja, Karvir, Arka, Malti, Neem, Apamarga should use for tongue cleaner should be made up of gold and silver coppers, brass, zinc, tin, or tree branches. Contraindication: indigestion, vomiting, dyspnea, cough, fever, thirst, oral ulcers, cardiac disease. Next is Anjana. To expel the impurities, morning and evening, never at night. Apply in lower eyelid from inner canthus to outer canthus. After applying Anjana, one should close his eyes and rotate the eyeball for spreading of Anjana in the whole eyes. Contraindication for Anjana after woman and Virachan after taking food. Next. Nasya. Nasal cavity is regarded as the door up to brain. 5 types of Nasya: Marsha, Pratimarsha, Avpida, Pradhaman, and Shirovirachan. Out of this, Pratimarsha Nasya can be taken daily routine. Benefits of Nasya: eyes, nose, ears becomes healthy and more powerful. Prevents hair fall and graying of hairs. Voice becomes soft and stable. Kaval Gandush. Keeping any liquid medicated oil or decoated in mouth, when it can When it can be moved in all direction, it known as gandush, and when it is known as not movable, it is known as kaval. Should be kept in mouth till sweating in forehead secretions coming out from the nose and eyes. Dhumpan. Dhumpan made up of useful medicinal plants only, and impressed in ghee should be used. Firstly, it should be inhaled through mouth and then from to nostril. Alternately, in all cases, smoke should be exhaled through mouth. Benefits: strengthen sense organs, makes mind stable and peaceful, voice becomes soft and pleasant. Contraindication of Dhumpana. After Virechana and Basti, patient suffering from Rakta Pitta Prameha Hatat Trishu आणि Urcha, after taking alcohol, milk, ghee, आणि in digestion. Next with is Abhyanga. Vatanasak. If it is not possible on whole body, then should be done at least one on heads, ears, and legs. It makes the bones and muscles strong, induces calmness and mind, relieve pain. Next, Vyayam. Physical exercise that is favorable to mind and exercise increases strength and firmness of body is known as Vyayama. Should be continued till half strength is exhausted. Benefits: feeling of lightness in body, increases strength and make the body parts firm and strong, increases the work efficiency, reduces obesity. Next, contraindication of Vyayam. Children and old persons during anger, fear, grief, and sorrow, during hunger and thirst, suffering from Jwara, Raktapitta, Shwas, Brahme, Rajakshma. Next, Uptanan means skin application. Rubbing medicated powder or paste on skin is known as Uptanan, which ensure a proper peripheral circulation. Kapahara. Bhrajak Pitta is activated, enhance skin glow, removes wrinkles, dissolves fat, provides strength to body parts. Next, Snan means bath. Hot water bath in lower portion of body is beneficial. In winters, warm water should be used, and summer, cool water should be used. First, wash hands and feet before taking bath. Benefits: initiate sleep, tiredness, yawning, sweating, itching, thirst, removal of body impurities, increases appetite, purifies the blood. Next, is Bastran means clothing. Dress should be comfortable, clean, and fresh, beneficial for skin, and should have a decent look, makes the person feel honorable. Next, Ratna Abhushana Dharana. Provide nourishment, mind becomes cheerful and body becomes beautiful. Wealth is attended, promotes life and provides energy and enthusiasm. Next, Ahara. Balanced diet is essential for good health. Nutritious, easily digestible and sattvic ahar should be contains all 6 rasas. Half of stomach should be filled with solid food, 1/4 is liquid, and rest is 1/4 should be empty for air to ensure easy digestion. Next. Okay, sir, thank you.
Thank you, Doctor.
Okay, sir.
Next, I invite Dr. Priyanka Nagare for the paper presentation. Dr. Priyanka Nagare, are you there?
Yes, sir.
Okay, Doctor. Please share the screen, Doctor.
Okay, sir. Hello. Hello.
Hello, doctor. Your screen is visible.
Yes,
doctor.
sir.
Please start, doctor.
Screen is visible?
Yes, doctor. Screen is visible. Please start, doctor.
Okay, sir. Hello, myself, Dr. Priyanka Nagare, PG Scholar student. My paper presentation topic is morphological presentation and therapeutic uses of Liliaceae family plants. Start from the introduction. It is commonly called as, this family is also commonly called as lily family. The plants of this Liliaceae family are monocotyledonous. Monocotyledonous means having a single cotyledon, perennial and herbaceous and flowering plants. It includes 250 genera and 4,000 species, which are worldwide in distribution. In India, it is represented by 169 species. Habitat: the Liliaceae family plants are herbs, rarely shrubs or small trees. It is distributed in temperate region of the northern hemisphere. Plants. Alum sativum, that is also called as lasun. Alum cepa, that is also called as palandu or onion. Aloe indica, it is also called as aloe vera or kumari. Colchium latium, it is also called as suranjan. Argenia indica, it is also called as vanapalandu or jungli pyaz. Asparagus racemosus, it is also called as shatavari. Asparagus adensens, it is also called as safed musli. Smilex china, it is also called as chopchini. Gloriosa superba, it is also called as langli. Then morphology of Liliaceae family plants are, the leaves of this family plants are alternate, exstipulate. Exstipulate means having no stipules in the leaves. Then linear. The venation is usually parallel but reticulate in smilex and trillium. It is shown in this figure. Then stem are perennial, aerial, grimy, or erect. Underground stem may be comb, bulb, or rhizomes. Then root. The root are normally adventitious or fibrous, but may be tuberous, as in case of asparagus species. Then fruits of this family are capsule, and then seeds are endospermic seeds. Inflorescence. Variable inflorescence are variable, solitary in tulip or fritillaria. Then panicled racemes in Asphodelius species. Cymodes umbel-shaped inflorescence in Allium and Smilex. Solitary axillary inflorescence in Gloriosa species. Then flower are bracteate or ebracteate, pedicellate, actinomorphic, hermaphrodite. Hermaphrodite means bisexual flower are present in a single plant. Hypogynous, axillary or terminal, solitary or twin or umbellate in the shape. It is trimerous in shape, means it having the flower having 3 petals. Then perianth, the tepals. Tepals means tepals are 6 in number. Tepals means undefined petals and sepals are present, are arranged in 2 whorls of 3 each, imbricate estivation. Then androecium, stamens are 6, 2 whorls of 3 to each. Epiphyllus, the androecium is joined to the perianth. Then dithecus, it contains 2 lobes. Gynoecium, tricarpillary, syncarpus. Ovary is superior, trilocular and axile placentation are present in this family. Then some plants of this family like aloe indica, it is also called as kumari in Ayurveda. It is also called as aloe vera. In Sanskrit, aloe vera is called Grit Kumari, which means young girls. This name is given to it because the Vedas believe that the plants gives the woman youth and it has a regenerating effect on the females. Then chemical constituents. phenolic anthraquinones, polysaccharides, glycoproteins, flavonoids, enzymes, vitamins, A, C, E, saponin, minerals, aloin, and imodine, and carbohydrates. Then therapeutic uses of aloe indica. It has a laxative action. The anthraquinones are a potent laxative. It increases the intestinal water content. It stimulates the mucous secretions and increases the intestinal peristalsis movement. Bhedan karma of Kumari is in Ayurveda is happened due to the anthraquinone content. Then analgesic, antibacterial, and antiviral action. It is happened because of aloe and imodine. It acts as an analgesic, antibacterial, and antiviral properties. The aloe vera increases the blood flow to the affected area, thus to help the healing process. It moisturizing and anti-aging. The mucopolysaccharide helps in binding moistures into the skin. Aloe stimulates fibroblasts, which produce the collagen and elastin fibers, making the skin more elastic and less wrinkled. Moisturizing and anti-aging effect. It is also having anti-cancer effect, anti-acne effect. Then antioxidant and wood.
Dr.
Hello, Dr. Priyanka Nagare. Can you hear me? I think it was some network problem. Next, I invite Dr. Pooja Ravindra for the paper presentation. Dr. Pooja, are you there?
Yes, sir.
Okay, doctor. Please share the screen, doctor.
Sure.
Dr. Pooja, your screen is visible, doctor. Please start, doctor.
Yes, sure. There's some technical issue from my side. Can you please share from your side?
Doctor, but your screen is visible, doctor.
Nobody is not moving ahead.
Doctor, turn off the sharing. Now it is moving, doctor.
Yes.
Yes, doctor, moving, doctor.
Yeah. Good evening, everyone. Myself, Dr. Pooja Kadu, PG second year from Prasuti Tantra Stri Rog Department from YMT Ayurvedic College, Kharghar. So today's topic for my presentation is Ayurvedic Management of Cervical Erosion, a case study. What is cervical erosion? Cervical erosion results from the extension of endocervical columnar epithelium beyond external cervical os to replace the squamous epithelium. The endocervical area has a columnar epithelium which then extends to the external cervical os, which leads to formation of cervical erosion. Columnar cells are constantly changing into squamous cells in an area of the cervix called the transformation or transitional zone. Symptoms, patient never comes with the complaint of cervical erosion. They're mostly symptomless. They come with a complaint of discharge, increase of normal cervical secretions, that is leukorrhea. Sometimes the secretion is also mucopurulent discharge, which is seen in infective cases. Contact bleeding means postcoital bleeding. They have infertility, backache, or pelvic discomfort. On PS examination, we get to see this bright area continues with the endocervix. Hyperemia, that is the reddish discoloration, associated pus or mucus discharge from the cervical canal, and cervicitis symptoms. Treatment in modern part, it is dithermic cauterization or electrocoagulation, cryosurgery, laser therapy, conization operation, and polycrystalline, that is a topical or vaginal suppository used for cervical erosion. Now the Ayurvedic view for cervical erosion. Cervical erosion can be correlated with Karnini yoni vapat, Akare vahamanaya garbena pihito anilaha, Karnika janayat yono, Shleshma raktena murchitaha, Raktamarga avarodhinya, Sataya karnini mata. This reference is from Charak Chikitsa 30, that is yoni vapat chikitsa. When a pregnant woman strains in absence of labor pain, it causes vata prakop, which then causes aggravation of kapha and rakta. This vitiated vat, kapha, and rakta, these three produces karnini, which is also known as elevation of protuberance like lesion in yoni. Shushrut Uttar Stan 38 has mentioned Karninyam Karina Yoni, Shleshma Asrubhyam Prajayate, Chaturashvi Api Chadyasu, Shleshma Lingo Uchreta Bhavit. According to Acharya Shushrut, vitiated kapha along with rakta produces karnika, that is an elevated lesion in yoni. Here, Acharya Shushrut has not mentioned about the vata, but only kapha and rakta dosha. Karnika word is derived from karnin, which means around protuberance, any elevation, pericarp of lotus, ear-like structure, or any outgrowth or tuber. Karnika Maunsakandi, Shleshma Linga Uchritihi, Paichilya Kandavadikaha. The Lhantika of this Shloka gives us information that kapha features like Paichilya and Kandu, vaginal itching, can also be seen as an associated symptom. So patient always come with white discharge, sticky or purulent discharge, and then on PS examination we get to see the cervical erosion. Now this is a case study. It is a 28 years old female who is a housewife, and she came with complaints of white discharge since 5 months, backache since 1 month, lower abdominal duct pain occasionally. Medical history was nil. Surgical history was lower segment cesarean section 5 years back. Menstrual history was regular cycles, 3 to 4 days, moderate flow, and painless. On examination, she was okay. Systemically also okay. PSPV examination, this was her eroded area of the cervix. White discharge was there. Cervical erosion was 2+, and hypertrophy was 2+. Uterus was anteverted normal size and mild tenderness in the fornices. Chikitsa given to her was Abhyantar, Chandraprabhavati 250 mg 2 BD, Trifala Gugul 250 mg 2 tablets BD. Duration was for 15 days. And Stanik Chikitsa was Yoni Dhavan with Trifalaquat, Apamargakshar Pratisaran, and Zatyadi Tel Yoni Picho. Treatment protocol was as follows. Yoni Dhavan, Apamargakshar Pratisaran, and Zatyadi Tel Yoni Pichu procedures were done from 6th day of menses for 7 days for 3 consecutive menstrual cycles. Then the symptoms assessment for 3 cycles were done. For first cycle, she was having complaints of white discharge, back pain, abdominal pain. Second cycle, white discharge was reduced, back pain was still there, and abdominal pain was also reduced. The third cycle, there is no white discharge, back pain reduced, and abdominal pain reduced. She got 90% relief of all her symptoms. First cycle, these all are cervix from first, second, and third cycle. After the procedures, erosion in first cycle was more, which is compared to the last, erosion was markedly reduced, hypertrophy was markedly reduced, and there was no white discharge till the end of the third cycle. Yoni Dhavan. Dhavati Shuddhyati iti Dhavanam. This is from Shushrut, Chikitsa Stan 28. Yoni Visheshena Shodhanam Nama Shuddhikaranam. Charak Sutra Stan 13/15. Content was Trifalaquat. Procedure. Yoni Dhavan is a deep cleansing of vaginal passage and Garbhashay Mukh, that is cervix, under all aseptic precautions with medicated kashay. Now this Trifala has an anti-inflammatory, antibacterial, and antioxidant properties which improve circulation and reduces infection. While she was having a white discharge, we have given her Yoni Dhavan with Trifalaquat. According to Ayurveda, it has Krimigna and Vranaropan, that is wound healing properties. Then was the Apamargakshar Pratisaran. Shar karma is like application of Apamargakshar over the external os of the cervix over the areas of erosion. Shar is Agni and Vayu Mahabhut Pradhan. It works like Chedan, Bhedan, and Lekhan karma. Shar acts as a corrosive, eliminating the unhealthy sludge and generates healthy base for healing. Application of Shar in case of cervical erosion is like an effective form of herbal cauterization. Zatyadi Tel Yoni Pichu. Procedure. Placing a cotton ball or tampon soaked in medicated oil in vagina. Vaishajya Ratnavali has this reference of Zatyadi Tel in Vranashod Chikitsa, which is described as Vranashodhaniya, that is wound purifier, and Vranaropaniya. It has Vatashamak, anti-inflammatory, and wound healing properties. Observation. Patient's symptoms of white discharge, backache, and mild abdominal pain were relieved by this treatment. PS examination also shows significant result for the same. Erosion was reduced, hypertrophy was reduced, and white discharge was nil. Conclusion: cervical erosion can be correlated to Karnini Yonivapat. Trifalakwat Yonidhavan acts as cleansing and anti-inflammatory property. Apamarga Kshar Pratisaran acts as mild cauterization due to its Lekhan and Shodhan properties. Datyaditil Yoni Pichu has runner open properties. Above mentioned treatment protocol is cost-effective Ayurvedic management for cervical erosion with reference to Karnini Yonivapat. Thank you.
Thank you, Dr. Pooja.
Thank you.
Next, I invite Dr. Rohini for the paper presentation.
Yes, sir.
Dr. Rohini, please share the screen, doctor.
Yes, sir.
Your screen is
Slides
visible,
are
doctor.
visible, sir.
Yes, doctor, visible, doctor. Please start, doctor.
Okay, sir. Myself, Dr. Rohini, and my topic is Arka Kalpana and its modern aspect. Introduction. As we all know, Arka Kalpana is described as one among the Panchavida Kashaya Kalpana by Lankapati Ravana in his text Arka Prakasha. Then here, some of the drugs contain active principles in the form of volatile oil. Hence, by using these drugs, if water is prepared while doing preparation, active principles may get evaporate. So this Arka Kalpana is prepared with such drugs. Then mainly it was done by Unani system of medications. And this Arka Kalpana was mainly available after 18th century onwards. References, Samhita Kala, we don't get any references for Arka Kalpana. Mainly we get references after the Samhita Kala, especially by Rasatantra Sara and Siddha Prayoga Sangraha. They give examples of 21 Arka Kalpanas. Importance of Arka Kalpana compared to Panchavida Kashaya Kalpana, it can be preserved for longer duration. It has good palatability and attractive color. It's more sterile method for preparation. It's cheaper method, and as it is liquid dosage form, it's having faster absorption than solid dosage forms. Definition: Arka Kalpana can be defined as a liquid preparation obtained by distillation of certain liquids or of drugs soaked in water using the Arka Yantra. There are classification of Arka based on Sthira Arka, Gandha Arka, and Drava Arka. According to duration of preparation, Nyuna Arka, Madhyama Arka, and Shreshta Arka. According to part used, Pushpa Arka, Sattu Dhanya Arka, Shiri Vriksha Arka, Vishavarga Arka, Taila Dhanya Arka, Sugandha Gana Arka, and Kandula Arka. Procedure: Arka is prepared by the process of distillation of water. Soak the raw drugs with the help of distillation apparatus. The volatile constituents which are evolved add mixtures with water vapor, then they are condensed and collected. Method of preparation: coarsely powdered drug is taken and prescribed quantity of water, soaked overnight till it turns soft, transferred to Arka Yantra and boiled. Vapor is condensed and distillation is collected in reservoir. Final product. Thus, produced Arka is a suspension of the distillate in water having slight turbidity. Depending upon the nature of crude drug undergoing for the distillation, the Arka will have characteristic color and odor. Precautions: mainly here, Agni maintenance is the main precaution. That is, Manda Agni should be maintained so that the water may not get vaporized. Then again, because of more heat, very soon the water content will get vaporized, hence there is a chance of burning and spoilage of Arka Dravya. Continuous water current should be maintained in the condenser. The vessel or the bottle in which the distillate is collected is placed in a container containing cold water. There are 6 Shadagnis explained for the Arka Kalpana: Dhuma Agni, Deepa Agni, Manda Agni, Madhyama Agni, Khara Agni, and Bata Agni. Prashasta Arka Lakshana: clear and transparent, must have taste of ingredients, comprehend the color of ingredients, have the same color of the drug when kept in Jeena Asti Mrita Patra, or if taken in any other vessel, it should have the color of Shanka and Chandra. Qualities of Arka unfit for therapeutic use is unpleasant odor if it causes giddiness, if it is turbid, and if taste, etc. are changed. Nature of the vessel for storage of Arka is Jeena Asti Mritika Patra, glass, stone, and clay. What should be done after consumption of Arka? Tambula or Lavana Shevana should be done. Shelf life is 1 year from the date of manufacturing. Dose is 10 to 20 ml as per API, and AFI is 12 to 24 ml. Anupana is equal amount of water. In modern pharmaceutics, Arka Kalpana can be compared to the distillation. It is a process of separating the constituents of a liquid by vaporizing the liquid and passing the vapors through a cold surface and thereby converting the vapors again into liquid. There are 5 types of distillation I mentioned here: simple, fractional, steam, vacuum, and destructive distillation. Analytical parameters for Arka Kalpana are description, color, odor, pH, volatile matter, specific gravity, clarity test, identification, assay for essential oil, test for heavy metals, microbial contamination, test for specific pathogens, pesticide residue. Here are some examples for Arka Kalpana and their indication: Ajamoda Arka, Brahmi Arka, Jatamamsi Arka, Gulab Arka, Kakamachi Arka, Shatavya Arka, Vishraya Arka. Conclusion: Arka is the most potent preparation included under the Panchavida Kashaya Kalpana of Ravana. It is the most potent due to dosha Haritattva and its specific gunas. It's having increased potency, reduced dose, and more shelf-life and also easy absorption, fast action, and better patient complaints. Arka can be prepared from herbs, minerals, and animal origin drugs. Arka can be used for secondary preparations. Arka can be prepared for modern distillation apparatus also. Although there are finite Arka preparations I mentioned in Arka Prakasha, only few are used in a clinical practice. So research work has to be done on Arka preparations to bring those excellent remedies to the mainstream. Thank you.
Thank you, Doctor. Next, I invite Dr. Kanchana Pol for the paper presentation. Dr. Kanchana, are you there? Hello, Dr. Kanchana, are you there?
Yes, sir, yes. Audible?
Hello, Doctor. Hello, Dr. Kanchana.
Hello?
Hello. Yes, Doctor. Now audible, Doctor.
Sir, audible, sir?
Yes, Doctor. Audible, Doctor. Please share the screen, Doctor.
Sir, can you share the slides, sir?
Okay, 1 minute, Doctor. Dr. Kanchana, please start, Doctor.
Slides.
It's a visible, Doctor. I think you have some network problem. Dr. Kanchana, are you there?
Yes, sir. So slides visible.
Slides is visible, Doctor.
I can see, sir, actually.
Doctor, you have some network problem, Doctor.
Network issue. Yes, sir.
Visible, Doctor?
No, yes, sir. Now it's visible, sir.
Okay, Doctor.
Good evening, everyone. Myself, Dr. Kanchana, first year PG scholar, Department of Prasuti Tantra and Stri Roga, SDM Bangalore, guided by Dr. Anusha, Associate Professor. Today I am presenting a case. Preliminary data. Name Mrs. Arpita, age 27 years, occupation accountant, marital status married, married life 1 month, name of husband Gopala Krishna, religion Hindu, address JP Nagar, socioeconomic status upper middle class. Next, sir. Pradhana Vedana, complaints of severe lower abdominal pain during menstrual cycle since menarche at the age of 15 years. Anubandha Vedana, associated with low backache during menstrual cycles and general body weakness since 10 years. Next. Vedana Vrittantha, a patient was apparently healthy 12 years ago. Gradually, she developed a squeezing type of pain in lower abdomen during menstrual
leads to low back. The pain begins from the onset of menstruation, which persists for 2 days, associated with general body weakness, which hampered her day-to-day activities, for which she consulted many allopathic hospitals and advised painkillers like meftal-spasol and aceclofenac, oral tablets, but she didn't get results. Hence, for further management, she visited our hospital. Aggravating factors: symptoms aggravate upon eating spicy food. Relieving factor: the pain will get relieved on intake of tablet, meftal-spas, and hot water bath after menstrual cycles. Purva Vyadhi Vruttanta. Medical history: no history of hypertension, diabetic mellitus, TB, epilepsy, STD, and nephritis. Surgical history: nothing specific. Kula Vruttanta. Mother had also suffered from similar complaint. Vaiktika Vruttanta: Ahara, vegetarian, consumes more of spicy food. Nidra 8 to 9 hours. Mala once in a day, regular. Mutra 4 to 5 times a day, normal in color. Vyasana: tea or coffee twice or thrice a day. Next, sir. Rajo Vruttanta: menarche at the age of 15 years. LMP 3rd December 2022. Regularity of the cycles: regular cycles 28 to 30 days. Duration of bleeding 3 to 4 days. Number of pads used: first day 2 pads per day soaked. Second day 2 pads per day partially soaked. Third day 1 pad partially soaked. Fourth day spotting. Nature of menstrual blood: bright red color at the beginning, then dark red color blood with mild clots. Next, sir. While white discharge not associated with odor, itching, burning sensation. Clear watery discharge on 14th day of menstrual cycle. Coital history: no dyspareunia, discomfort during coital act. Contraceptive: nothing specific. Rogi Pariksha, Dashavida Pariksha, Prakriti Vata Kafaja, Vikruti Dosha Vata and Dhatu Rasarakta, Sara Madhyama, Samhana Pramana Madhyama, Satna Madhyama Satna, Sattva Madhyama, Ahara Jarana and Abhyavarana Shakti Madhyama, Vyayama Shakti Madhyama and Vaya Madhyama. Ashtavida Pariksha, Nadi Vata Kafaja, Mutra 4 to 5 times a day, Mala once a day, Jivha Alipta, Shabda Prakruta, Sparsha Anushna Shita, Drik Dusra Varna, Akriti Madhyama. Next, sir. General examination: decubitus sitting, nourishment well nourished, pallor absent, icterus absent, cyanosis clubbing absent, lymphadenopathy absent, weight 45 kgs, weight 5 feet. Next, sir. Vital signs: blood pressure 120 by 80 mmHg, temperature 97 Fahrenheit, respiratory rate 18 to 20 times per minute, pulse 80 per minute, heart rate beat per minute. Systemic examination: respiratory inspection, upper respiratory tract nostril intact, nasal septum no deviation, lower respiratory tract shape and symmetry of chest elliptical and bilateral symmetrical, palpation position of trachea centrally placed, auscultation normal vesicular breath sound heard. Cardiovascular system S1 and S2 heard, palpation apical impulse, fifth intercostal space, murmur absent, musculoskeletal system gait normal, superficial reflexes and deep reflexes within normal limits, nervous system consciousness, conscious to time, place, person, cranial nerve examination, all 12 cranial nerves are intact. Next, sir. Gastrointestinal system inspection, absence of stria, visible pulsation, veins, mass absent, umbilicus centrally placed, retracted, distension, no distension of abdomen. Local examination, external genitalia, normal growth of pubic hair, vulva, normal, no redness. Bimanual examination, anteverted uterus, normal size, PV, that is per vagina, per speculum, vagina healthy, cervix healthy, no cervical motion tenderness, no adnexal tenderness. Provisional diagnosis based on Nidan and Lakshana, primary dysmenorrhea, that is Udavarthini Yonivapat. Next. Prayogashala Pariksha, complete blood count, ultrasonography and urine routine. Ultrasound report impression was no sonological detectable abnormality in the abdomen and pelvis, no ovarian cyst or PCOS bilaterally. Next, sir. Samprapti Ghataka, Dosha Vata Pradhana, Anubandhita Dosha Pitta and Kapha, Dhatu Rasa Rakta, Upadhatu Arthava, Agni Jatra Agni Vishamata, Strotrus, Arthavaha Strotrus, Shroto Dushti, Sangha and Vimarga Gamana, Udbhavasthana Ama Pakvashaya, Rogamarga Abhyantara, Sthana Samshraya Garbhashaya, Vektasthana Garbhashaya. Roga Pariksha, Nidhana Katurasa Pradhana Ahara, Ruksha Ahara Sevana, Vegadharana, that is Mutra, Purva Rupa Avyakta, Rupa, squeezing type of pain in lower abdomen associated with low back pain and generalized weakness during menstruation. Next, sir. Samprapti, Vata is Pramukha Dosha, Pitta and Kapha is Anubandhita Vishamata, impairs the formation of Rasaraktadi Dhatu, Dosha Dushya Samurchana in Arthavaha Shrotas, vitiates Apanavayu, Prakupita Vayu produces Toda and Kapha produces Avrodha in Arthavaha Shrotas, causing Udavarta Yonivapat. Next, sir. Vyavachedaka Nidana, Vataja Yonivapat, Mahayoni, Paripluta Yonivapat, Vataja Arthava Dushti, Udavartini Yonivapat, modern disease, adenomyosis, endometriosis, pelvic inflammatory disease, fibroid uterus, others, intrauterine contraceptive device. Next, disease inclusion and exclusion. Vataja Yonivapat because there is Shula, Nistoda and painful menstruation. Exclusion because there is no Karkashata, Stabdata, Bramsha of Yoni. Inclusion, Mahayoni, pain. Exclusion, Yoni Mukha, Vishtamba, Mamsostanna, Vivritta, no mass during local examination. Paripluta Yonivapat because pain. Exclusion because dyspareunia. Vataja Arthava Dushti, inclusion, pain. Exclusion, Arthava is Tanu, Ruksha, Fenila, Alpa and Aruna. Udavartini Yonivapat, inclusion, Urdhvagati of Arthava, Sakashta Bhadda Arthava, no exclusions. Next, in modern adenomyosis, inclusion, pain. Exclusion, prolonged menstrual bleeding, dyspareunia, irregular menstruation, heavy or spotting. Endometriosis, inclusion, lower abdomen pain and back pain. Exclusion, dyspareunia, pain while defecating, abnormal menstruation. Pelvic inflammatory disease, inclusion, lower abdomen pain. Exclusion, irregular excessive bleeding, abnormal vaginal discharge and dyspareunia, fever. Fibroid uterus, inclusion, spasmodic pain in lower abdomen. Exclusion, menstrual abnormality, dyspareunia. Primary dysmenorrhea, pain in lower abdomen with onset of menstruation. Exclusion, no any organic lesion. Vyadhi Vinishchaya, Udavartini Yonivapat, primary dysmenorrhea. Next, Udavartini Yonivapat, Vega Udavartanadhyo, Yonim Udavartya Anilaha, Sir Ugartha Rajaha Kruchrena Udavartavam, Vimuchati, Athave Sa Vimuktetu, Takshanam Labate Sukam, Rajaso Gamanam, Urdhvagneya Udavartini, Charaka Chikitsa, 30th chapter, 25th, 26th shloka. According to Charaka, due to Urdhvagati of Vega like Apanavayu, etc., Apanavayu gets aggravated and vitiates the Yoni. Thus, vitiated Apanavayu causes Udavartini Yonivapat. Next, primary dysmenorrhea. The primary dysmenorrhea is one where there is no identifiable pelvic pathology. Chikitsa Sutra, line of treatment, Nahi Vatadyate, Yoni Narinam Sampradushyati, Shamitva Tamanasya Kuryadoshasya Bheshajam, Charaka Chikitsa, 30th chapter, 116 shloka. The disorders of Yoni do not occur without vitiation of Vata, and pacification of Vata should be done by elevating procedures of Vata. Specific treatment, Vata Vyadihara Karma, Vatarthanam Sadahitam, Auduka Anupajair Mamse, Kshire Satilatandule, Sa Vatagno Aushado, Nadir Kumbi Svedo, Rupacharit Akatam Lavanatailena, Sa Sham Prastara Sankare, Switram Koshna Ambu Siktangi, Vatagner Bor Jayadrase, Vatatarya Pichum, Tadhyagnoscha Pranayetat, Vathartanam Cha Yoninam, Sekha Abhyanga Pichukriyaha, Ushna Snigdha Prakarta Vestailani, Snehananischa, Himsra Kalkatu Vatharta Koshnam Abhihanjaya Dharayet, Trevrittam Snehanam Svedo, Graume Anupo Udaka Rasaha, Dashamula Payor Bastischo, Udavartini Lartishu, Trevrit Anuvasasyascha Bastischa Uttara Sangshitaha, Charaka Chikitsa, 38th chapter. Sir, next. Next, sir. Treatment protocol advised, oral medications, Mahavagracha Gugulu, 1 TID, Dhanvantaravatti, 1 TID, Dashamura Kshirapaka, 40 ml BD, Avipattikara Churna, 1 teaspoon in night with warm water for 1 month. Thank you.
Thank you, Doctor. Next, I invite Dr. Sabha Taranam for the paper presentation.
Hello.
Hello.
Am I audible?
Audible, Doctor. Please share the screen, Doctor.
Just a minute.
Your screen is visible, Doctor.
Okay.
And also moving.
Okay. Good evening. Myself, Dr. Sabha Taranam, Taranath Government Ayurvedic Medical College, Bellary. My topic of presentation will be on Avaleha Kalpana. Lihi Aswadane, dosage form which is neither too thin nor too thick, lickable, that is semi-solid. Avaleha has been derived from the root word Lihi Aswadane, which means lickables which has good taste, and it's Upakalpana of Kwatha Kalpana. It is most popular due to its dosage form, which helps in easy administration, palatability, and long shelf life. The oral transmucosal route has significant potential for drug delivery both systematically and locally. Avaleha can be called as food or the part of food that provides medical and health benefits, including prevention and treatment of the disease. Kwathadina punaha pakat ghanatvam sa rasakriya so avalehascha leha syat tanmatra syat palonmita. Any liquid preparation, kwatha or swaras, etc., if boiled and reduced to a thicker consistency, then the thicker mass obtained is called rasakriya. By adding madhura dravyas, obtained drug is called as avaleha. Avaleha kalpana was first described by Acharya Charaka and it is widely used as rasayana by Charaka, Sushruta, Vagbhata. Acharya Kashyapa has given importance to this kalpana and has described separate chapter in Leha Adhyaya and Sutrasthana. But pharmaceutical principle was first described by Sharangadhara in Sharangadhara Samhita. Other names for avaleha are rasakriya, leha, lehya, avaleha, ghana. Difference between rasakriya and avaleha. Usually people might get confused, but rasakriya is nothing but any liquid preparation, if boiled and reduced to a thicker consistency, obtained thicker drug mass is called as rasakriya. Example, Darbi rasakriya and rasanjana. According to Dalhana, to prepare rasakriya, 8 or 16 part of water is added and reduced to 1/8 or 1/16 part and filtered. Filtrate further, boil and reduce to thicker consistency like fanita or honey. Avaleha is nothing but it is semi-solid preparation of herbal drugs prepared in decoction or extracts in different herb by adding sweetening agents like jaggery, sugar, sugar candy. Best example is Chyawanprash avaleha, which everyone knows. Sharkara. Preparation are concentrated or saturated solution of sucrose obtained in syrup consistency. It was introduced by Yadavji Trikamji. It varies from Panaka Kalpana. Thanda, same as that of Avaleha. One step ahead, that is 1 to 2 thread consistency of Avaleha Paka Lakshana, which will lead to granular consistency. Example, Haridra Khanda. Preparation method of Gudapaka can either be in form of avaleha or khanda or modaka. Because guda is major ingredient, it is bought under guda kalpana. Ingredients: drava dravya, that is kashaya swaras or any liquid preparation. Madhura dravya, substrate like sugar, sugar candy, jaggery. Prakshepaka dravyas like powder drug which has volatile principles. Sneha dravya, lipid media, that is ghrita or tilataila. Additives will be like honey, salt, shara, bhasma. Ingredients of avaleha, which I have told already. Drava dravya, there is asneha pradhana and sneha pradhana. Asneha pradhana constitute of kwatha, swarasa, gomutra and jala. Sneha pradhana will be ghrita and taila. They act as yoga vahi, softness and increases the self life. Madhura dravya is sita, guda, ikshurasa and madhu, which increases the palatability, increases self life, give instant energy. Prakshepaka dravya is samanya, that is kashta aushadhis, and vishesha will be rasa aushadhi, which enhances the bioavailability, therapeutic efficacy, and increases the taste, that is ruchikara. Anuktamana, sita chaturguna karya, churnancha dviguno gudaha, dravyam chaturgunam datyat iti sarvatra nishchaya. That is one part of guda, one part of churna, 2 parts of guda, 4 parts of sharkara, and 4 parts of drava dravya. Equipments like patra, darvi, heating gadgets, clean cloth for filtration. Various other methods vessels are used in various avaleha, peculiar avalehas like Kushmanda avaleha, Tamra vessel is used. Reference will be Sharangadhara Madhyamaganda, 8th chapter. Brahma Rasayana like Audumbara Patra, that is nothing but Tamra Patra itself. Amruta Prasha avaleha, Rajata Patra, silver vessel. Agastya Haritaki, Tamra Patra. Bhallataka avaleha, Loha Patra. Method of preparation: the kashaya swarasa is prepared. Madhura dravyas are dissolved and heated over mild fire. The blend should be filtered to remove physical impurities. The filtrate is again boiled to a thicker thread-like consistency. Ghee or oil is added to the preparation just before attaining paka lakshana. Prakshepaka churna can be added after taking out from the fire. Honey is added after cooling, and final product is packed and preserved in dry inert containers. Just what I have explained, this is the general method of preparation. Avaleha having different method of preparations like Manibhadra Guda and Pippali Guda. Anagni Siddham, in the absence of heat, by pounding all the ingredients together, avaleha is prepared. Chyawanprash, as we all know, amlaki is made into paste form, fried in ghee and oil, and after removing the seeds. Agastya Rasayana, Haritaki paste is fried in ghee and oil. Kushmanda avaleha, small pieces is crushed by taking out swarasa and fried in ghee. Asanna Paka Lakshana. Darvi Pralepatva, stickiness of the sugar solution to the ladle. Tantumatvam, avaleha should come up to a thread like if it is taken out in between thumb and index finger. When drop of the sugar solution is poured into vessel filled with water, it should sink inside and does not spread in water. The drop sinks into the bottom but does not spread and easily picked with fingers. The drop which is poured over the plate and does not spread and does not break. Siddha Paka Lakshana. Supakve tantumatvam syat avaleha apsu majjati kharatvam pidito mudra gandha varana rasodbhavaha. Here sukha sparsha means soft to touch. So sukha mudra marda means when it is it feels soft even after rubbing between the fingers. Gandha varana rasodpatti, having taste, color, smell that of the ingredients. Pidate mudra forms impression of the thumb when pressed. 2 or 3 thread consistency recommended for avaleha indicates the presence of 65 to 70% of sugar in the final product. The percentage is sufficient and acts as preservative. Gandha, varna, rasa, etc. of the drug in final product indicate the proper extraction of the drug in the final product. Duration required. Few peculiar avalehas require different duration, like Ghrita and Taila should not be prepared in one day because of it gains some important properties. In classical, there are references available where final product of the same avaleha, it should be kept in certain place for certain days for maturation. References are here. Brahmarasayana inside Bhumi for 15 days. In Charaka Chikitsa first chapter, he has explained. Amlaka avaleha inside Bhumi for 6 months. Kutaja avaleha in Dhanya Rashi for 15 days. And Shatavari Kuda for 7 days. Storage, avaleha should be kept in white mouth glass or porcelain container or a plastic container by little space between lid and material, which should not react with it. The vessel should be tightly packed and proper labeling should be done. Dosage, the dosage of avaleha mainly depends upon the rogabala and rogibala and also intention for which avaleha is used. Tanmatra syat palon mitam by Sharangadhara Samhita, he tells 1 pala, that is 48 grams. Tanmatra Karsha Samhitam by Yadavji Trikamji, that 1 Karsha, that is 12 gram. Anupana, Dugdha Mikshu Rasa Yushaha Panchamula Kashayajam, Vasa Kvato Yatha Yogyam Anupanam Prashasyate. According to Acharya Sharangadhara, avaleha can be administered along with milk, sugarcane, Yusha, Panchamula Kashaya, Vasa Kvata. Avaleha can be taken with other liquid substances according to diseases. Few examples like Kutaja Ashtaka Avaleha. He mentions Anupana is Jala, Chaga Dugda, Manda in Sharangadhar Madhyama Khanda. In similar reference, he also tells Kutaja Avaleha, wherein Anupana is Aja Dugda, goat milk, Takra, and Dadhi. Self-life and example, Saviryata Avadhi is 1 year. That is example like Chavanpras, Vasa Avaleha. In Charaka Samhita, few of the avalehas as mentioned here. In Rasayana Adhikara, Brahma Rasayana, Chavanprash, in Gulma, Dantaharitaki, Raja Yakshma Nashaka Leha, Sarpiguda in Shatakshina. Ashtangradaya also mentioned few of the avalehas. Bhaishaja Ratnavali, Yoga Ratnakar. Advantages: palatability, water and lipid soluble extracts are achieved, increases self-life as they are carbohydrate in nature, provide instant energy, that is Balya and Rasayana. Mode of action: avaleha are intended to provide better drug absorption through the oral cavity. The oral transmucosal route have significant potential for drug delivery both systematically and locally. The oral cavity is highly hydrated environment that facilitates drug dissolution, and small surface area of the oral membrane is also beneficial for sustained drug delivery medicated like Haridra Khanda. The presence of salivary amylase and lipase in oral cavity helps in assimilation of carbohydrates and lipophilic ingredients such as Ghrita, Taila, and Avaleha. Oral absorption can also be overcome from hepatic first pass metabolism and improve the bioavailability. The next level of absorption takes place in stomach, wherein gastric enzyme lipase, amylase, and pepsin acts. The absorption of the avaleha is facilitated by presence of villi and microvilli in small intestine, which increases the surface area of the mucosa. From the lumen of the small intestine, the substance passes through the lacteal of the villi and cross the mucosa and enter the blood directly through the lymphatics. Conclusion: avaleha kalpanas can be compared with nutraceuticals, but not with the functional food and dietary supplement. The component of like medicinal drug along with jaggery, sugar, honey, ghee, oil, milk, etc., fulfill the needs of nutraceutical, that is both nutrition and pharmaceutical effect. Avaleha contains protein, carbohydrates, minerals, vitamins, and fats, along with pharmacological active substances. Thank you.
Thank you, doctor.
Next, I invite Dr. Khushbu Shailesh Akade. Dr. Khushbu.
Yes,
Are you there?
Hi, yes, ma'am.
Okay, please share the screen.
Okay. Sir?
Yes. Is there any problem?
Can you please share my screen?
Okay, doctor. 1 minute, doctor.
Okay, we'll share.
Doctor, please start the session, doctor.
Yes, sir. Sir, I am audible?
Yes, doctor, audible, doctor. Please start, doctor.
Okay, sir. Good evening, all. Myself, Dr. Khushbu Shailesh Akade from SMBT College, PG Scholar second year from Kaichikisa department. Today, I am going to represent my topic multiple sclerosis. Definition: it is an autoimmune disorder that affects the central nervous system. When a person has an autoimmune disease, the immune system attacks healthy tissue just as it might attack a virus or bacteria. The autoimmune disorders of nervous system can attack the central nervous system, which includes brain and spinal cord. Or peripheral nervous system consists of nerves that connect the central nervous system. Autoimmune nervous system disorders include multiple sclerosis, myasthenia gravis, and Guillain-Barré syndrome. Incidences of occurring MS. Onset occurs between 20 to 40 years of age. Women are most affected than men. Whites are more affected than Hispanics, blacks, or Asians. Most prevalent in colder climates of North America and Europe. Migration is also one of the cause of MS. Etiology and risk factors. Most theories suggested that MS is an immunologic viral disease. Risk factors are age, most of the time between 20 to 40 years. 6. Women have more chances. Family history, genetic susceptibility. Certain infections like Epstein-Barr virus. Climate, more in cold climate areas. Certain autoimmune diseases, higher risk with thyroid disease, type 1 DM or IBD. Smoking, stress, fatigue, physical injury, and pregnancy. Pathophysiology. Sir, next slide. Due to etiological factors, activated T cells expressed in central nervous system and macrophages enters brain from peripheral circulation. They produce inflammatory cytokines and reactive O2 species. Then inflammation occurs. After that, activated T cells and B cells cause demyelination and destruction of oligodendrocytes. Formation of plaque causes scarring and destruction of sheath. After that, compensatory system starts causing subsidation of edema and inflammation. After that, some remyelination process occurs, which is often incomplete, and multiple sclerosis occurs. Next slide. Clinical manifestations. Course of illness varies by person to person. There are 4 clinical patterns. First one is relapsing remitting MS. Second one is primary progressive MS. Third one is secondary progressive MS, and fourth one is progressive relapsing MS. First type, relapsing remitting MS. Most common initial pattern, episodes of acute worsening with recovery and a stable course between relapses. Second one is primary progressive MS. Gradually, nearly continuous neurologic deterioration from onset of manifestation. Third one is secondary progressive MS. Sir, next slide. Secondary progressive MS. Gradual neurologic deterioration with or without superimposed acute relapses in a client who previously had relapsing remitting MS. Fourth one is progressive relapsing MS. Sir, progressive relapsing MS. Gradual neurologic deterioration from the onset of manifestation but with subsequent superimposed relapses. Other symptoms include cerebral sign includes nystagmus, ataxia, dysphagia. Emotional problems include fatigue, depression, deconditioning, medication side effects, etc. Motor signs includes weakness or paralysis of limbs, trunk or head, diplopia, scanning speech, spasticity of muscles that are chronically affected. Other symptoms, sensory symptoms includes numbness, tingling and other paresthesias, patchy blindness, blurred vision, vertigo, tinnitus, decreased hearing, chronic neuropathic pain, radicular pain in lower thoracic abdominal region, and Lermit sign is a transient sensory symptom described as electric shock radiating down the spine or into limbs with flexion of neck. Next slide, diagnostic evaluation. There is no definitive test for MS. Detailed history of episodes of neurologic dysfunction and physical examination. Diagnostic test also includes CSF evaluation for presence of IgG antibody or oligoclonal bonding, evoke potential of optic pathways and auditory system to assess presence of slow nerve conduction, MRI of brain and spinal cord to determine the presence of MS plaques, CT scan to detect the areas of demyelination but with less detail as by MRI. Next slide, medical management. No exact cure. Aim is to prevent or postpone the long-term disability. The treatment falls into three categories: treatment of acute relapses, treatment aimed at disease management, and symptomatic treatment. Treatment of acute relapses includes corticosteroid therapy. For example, methylprednisolone given IV or orally, azathioprine and cyclophosphamide in severe cases. Then treatment aimed at disease management, treat exacerbations, interferon for ambulatory clients with relapsing remitting, give interferon beta 1b beta seron give subcutaneously. For treating relapsing form of MS, give interferon beta 1a agonist, and for relapsing remitting MS, gladiramide acetate copaxone. Also use symptomatic treatment. Next slide. For bladder dysfunction, oxybutynin propanthelin. For constipation, psyllium hydrophilic muciloid suppositories. For fatigue, amantadine and modafinil are used. For spasticity, baclofen and diazepam dantrolone used. For tremors, propranolol, phenobarbital, clonazepam are also used. For diastasis and trigeminal neuralgia, carbamazepine, phenytoin and amitriptyline are used. For diastasis, transcutaneous electrical nerve stimulation is also helpful. Next slide, nutritional therapy. Megavitamin therapy includes cobalamin, vitamin B12 and vitamin C, low-fat diet and high roughage diet to relieve constipation. Other therapies includes physical and speech therapies, exercise and water exercise. Next slide, surgical treatment. Deep brain stimulation. Deep brain stimulation, if other options have failed, then a device is implanted that stimulates an area of brain in case of severe tremor or severe tremor in limbs. Second one is implantation of a drug catheter or pump. A catheter is placed in lower spinal area to deliver a constant flow of drug like baclofen in case of severe pain or spasticity. Thank you.
Thank you, doctor.
Okay.
Next, I invite Dr. Masarao Daneshwar Bengal for the paper presentation.
Yes, sir.
Okay, doctor, you are audible, doctor.
Yes, sir. Yes. Sir, my screen is visible.
Yes, doctor, visible, doctor. Please start, doctor.
Yes, sir. Yes. Good evening to all of you. My name is Dr. Masarabenga, PG Scholar, Rognidan Department from Government Ayurvedic College, Nanded, guided by Dr. Krishna Kadam, Assistant Professor, Government Ayurvedic College, Nanded. Today is my presentation on topic of a review of kidney function test. First, introduction. Firstly, we have to see the kidney functions. There are different types of kidney functions like regulatory function, excretory function, and endocrine function. In regulatory function, kidney regulate water electrolyte balance, acid-base balance, fluid osmotic pressure. In excretory function, there are many substances excreted by kidney like blood urea, uric acid, creatinine, and many types of drugs. Third one is endocrine function. The kidney is secreted three hormones, that is renin, erythropoietin, and vitamin D3. The renin is used for blood regulation, blood pressure regulation, and erythropoietin for formation of red blood cells. Then we have to see the indication, the conditions in which we advise the kidney function test. Firstly is for early identification of impairment of renal function, then diagnosis of renal diseases like glomerular nephritis, nephrotic syndrome, then access response of renal treatment, plan renal replacement therapy, adjust dosage of chemotherapy, and in diagnostic technique like CT scan, in which when we advise CT contrast, then KFT. First, we have to see serum creat. Then we have to see kidney function test. Kidney function test mainly divided into two types. Then first we have to see glomerular function and then tubular function. In glomerular function, the clearance test to measure the glomerular filtration rate. Then in biochemistry, blood urea, serum creatinine, then microalbuminuria, albuminuria. In tubular function, we access proximal tubular function, in which we have to see glycosuria, phosphate urea, uricosuria, amino acid urea, tubular protein urea, fractional sodium excretion. In distal tubular function, specific gravity, osmolality of urine, water deprivation test, and ammonium chloride loading test. First, we have to see glomerular filtration rate. Best test for assessment of renal function in health and disease. GFR varies according to age, sex, body, and weight. Normal glomerular filtration rate is 120 to 130 ml per minute. In chronic kidney disease, on the basis of glomerular filtration rate, we differentiate into 5 types. That is, if glomerular filtration rate is greater than or equal to 90 ml per minute, then we suspected for microalbuminuria, proteinuria, hematuria, and radiologic histologic changes. If glomerular filtration rate is within the limit 60 to 89 ml per minute, it is mildly reduced for estimation of progression of disease. If glomerular filtration rate is within 30 to 59 ml per minute, is mildly moderately reduced for evaluation and complication of treatment. Then if glomerular filtration rate is 15 to 29 ml per minute, is severely reduced glomerular filtration rate for preparation for kidney replacement therapy. And if glomerular filtration rate is less than 50 ml per minute, then kidney replacement advisor, if UMI is present. For glomerular filtration rate, we have to first see the clearance test. Glomerular filtration rate refers to the rate in ml per minute at which a substance is cleared from the circulation by glomerular. If substance is not bound to protein in plasma, is completely filtered by the glomerular and is neither secreted nor reabsorbed by the tubes, its clearance rate is equal to glomerular filtration rate. That is the formula of clearance test. UV upon P. U is the concentration of substance in urine in mg per deciliter. Then V is for volume of urine secreted in ml per minute, and P is for concentration of substance in plasma in mg per dl. There are different types of agents used for clearance test, that is endogenous and exogenous. In endogenous, that substance which is secreted by our body, that is creatinine, urea, cystatin C. In exogenous agent like inulin or inoxazole. Creatinine clearance in clearance test, the creatinine clearance is most commonly used, not dependent on diet, not metabolized by liver, not absorbed and secreted by tubules, completely filtered by glomerular. Then we have to see blood biochemistry. In blood biochemistry, blood urea nitrogen and serum creatinine is seen. In blood urea nitrogen, its normal range is 7 to 18 mg per deciliter. It is increased in pre-renal, renal, and post-renal conditions like shock, impairment, obstruction, high protein diet, and increased protein catabolism. Second one is serum creatinine, more specific and more sensitive than blood urea nitrogen. Creatinine levels reflects reduction of glomerular filtration. Its normal range is 1 to 1.5 mg per deciliter. If creatinine is serum creatinine is increased in pre-renal, renal, and post-renal azotemia. Azotemia means increase of blood urea level. Large amount of dietary cooked meat, measure muscular body habits, active acromegaly, and gigantism. If serum creatinine is decreased in condition, like if it is female sex, vegetarian diet, malnutrition, and muscle wasting, increasing age. Then we are last is we have to see test evaluate tubular function to access proximal cannulated tubule. That is glycosuria, glucose in urine but not in blood, like Fanconi syndrome or diabetes insipidus, due to specific tubular lesion which impairment of glucose reabsorption and benign condition. Then amino acid urea, defective, if there is a defective tubular reabsorption, then we have to see amino acid urea. In proteinuria, it is indicative of renal tubular damage and fractional excretion of sodium. It is a distinguish between pre-renal azotemia and tubular necrosis. To access a distal cannulated tubule, in which the specific gravity state of it is decreased in diabetes insipidus, chronic renal failure. Second one is osmolality, measures number of dissolved particles in a solution expressed in millimole per kg of H2O, defective tubular reabsorption. Third one is water deprivation test, used to diagnose diabetes insipidus, distinguish between central and nephrogenic diabetes insipidus. And last one is ammonium chloride loading test for causes of metabolic acidosis. Thank you, sir.
Thank you, Doctor. Next, I invite Dr. Gauri Dharmendra Sharma for paper presentation. Dr. Gauri.
Hello.
Dr. Gauri, are you there?
Hello. Yeah, am I audible?
Yes, Dr.
Yes,
Audible.
yes, you are audible.
Just a second.
Please share the screen. Okay, okay.
Hello.
Yes, doctor.
Ma'am, can you please share my slide as it is unable for me to share?
Okay, we'll share full.
Hello, Dr. Gauri.
Yeah, yes.
Doctor, we will call you on after next doctor.
Okay.
Okay. Next, I invite Dr. Nikita Khadirkar for the paper presentation and poster presentation. Dr. Nikita, are you there? Dr. Nikita, are you there?
Hello.
Hello.
Yes, sir. Am I audible?
Audible, doctor.
Okay.
Please share the screen, doctor.
Yes, sir. 1 minute. Is my paper presentation visible, sir?
Not visible, doctor.
Yes, sir.
Yes, now visible, doctor.
Okay, sir. Good evening, everyone. Myself, Dr. Nikita, PG Scholar, Kriyasharya Department, JSC Usmanabad. My topic name is Ayurvedic Aspect of COPD with special reference to spirometry. Introduction. COPD, which includes chronic bronchitis and emphysema, is the fourth leading cause of death, and its prevalence has been increasing steadily over the past 20 years. The main reason may be rapid socioeconomic development, which has resulted in a lifestyle transition from traditional to modern. From Ayurveda point of view, COPD can be termed as disorder of transverse roots, as etiological factors and clinical features described in Ayurvedic classics for transverse rutadrushti are nearly similar with those of COPD and occurs usually in the prolonged conditions of CAS or stomach shwas. COPD, chronic obstructive pulmonary disease, is a type of progressive lung disease characterized by long-term respiratory symptoms and airflow limitation. The main symptoms include shortness of breath and cough, which may or may not produce mucus. The two most common conditions of COPD are emphysema and chronic bronchitis, and they have been the two classic COPD phenotypes. So here is the image section of a lung showing the centrolobular emphysema with enlarged air spaces in the center of a lobule. COPD, mostly it consists of emphysema and chronic bronchitis. Emphysema is defined as enlarged air spaces whose walls break down, resulting in permanent damage to the lung tissue. And chronic bronchitis is defined as a productive cough that is present for at least 3 months each year for 2 years. Here is the image showing the normal alveoli and the emphysetic alveoli. The alveolar membranes break down in the emphysetic condition. And second image, it is the normal bronchus and the inflamed and the bronchus with excess mucus. It is seen in the condition in bronchitis. What raises your risk of COPD? So first is smoking. The main risk factor for COPD. Most people who have COPD smoke or used to smoke. The other lung irritants, the long-term exposure to air pollution, chemical fumes, and dust from the environment or workplace, smoke from home cooking and heating fuels without ventilation, and second-hand smoke, which is smoke in the air from other people smoking. Changes to lung growth and development. Diseases affecting the lungs when a baby is still in the uterus or during childhood can increase the risk. Infections such as HIV and tuberculosis can raise your risk. Age play a role in COPD risk if you have other risk factors such as smoking. Most people who have COPD are at least 40 years old when symptoms begin. A condition that runs in families called alpha-1 antitrypsin deficiency, AAT deficiency. If you're born with this condition, smoking or long-term exposure to fumes or dust can lead to lung damage and COPD. Asthma. About 1 in 5 people who have COPD also have asthma, a lung disease that causes swelling and narrows the airways. So how we diagnose this? A test called spirometry can help show how well your lungs are working. You will be asked to breathe into a machine called a spirometer after inhaling a medicine called a bronchodilator. The spirometer takes 2 measurements: the volume of air you can breathe out in a second and the total amount of air you breathe out. You may be asked to breathe out a few times to get a consistent reading. Then there is chest X-ray, blood test. A blood test can show other conditions such as a low iron level, anemia, and high concentration of RBC, polycythemia. Spirometry normal values and how to read the test results. So normal results for a spirometry test vary from person to person. They are based on age, height, race, sex. The doctor can, once you have done the test, they look at your test score and compare that value to the predicted score. It is considered as normal if it is 80% or more of the predicted value. Spirometry measures 2 key factors: expiratory forced vital capacity, FVC, and forced expiratory volume in 1 second, that is FEV1. The doctor also looks at this combined number known as the FEV1 or FVC ratio. If you have obstructed airways, this translates to a lower FEV1 and FEV1 or FVC ratio. So FVC measurement, it is the greatest total amount of air you can forcefully breathe out after breathing in as deeply as possible. For children aged between 5 to 18, the predicted percentage, if it is 80% or greater, it is considered as normal. Less than 80%, it is abnormal. For adults, it is greater than or equal to the lower limit of normal, then it is normal. And if it is less, then it is abnormal. An abnormal FVC could be due to restrictive or obstructive lung disease and other types of spirometry measurements. An obstructive or restrictive lung disease could be present by itself, but it's also possible to have a mixture of these 2 types. FEV1 measurement. The second key spirometry measurement is FEV1. This is the amount of air you can force out of your lungs in 1 second. It can help to evaluate the severity of your breathing issues. According to guidelines from the American Thoracic Society, 80% or greater predicted FEV1 value, then it is normal. Then the result is normal. 70% to 79, it is mildly abnormal. 60 to 69, moderately abnormal. 50 to 59%, moderate to severely abnormal. 35 to 49%, severely abnormal. And less than 35, it indicates very severely abnormal condition. So FEV1 or FVC ratio, a low ratio suggests that something is blocking your airways, like 5 to 18 years old. If the ratio is less than 85%, so there is something obstruction. And in adults, less than 70% indicates the obstruction. Pranava Srotas, the vital sign of life is Shvasan Prakriya. So respiration, that is respiration, which start right from the birth to death. This vital act of respiration carried out by Pranvayu and the process of respiration occurs in Pranava Srotas. Pran is said as Pavan or Anil, that is wind or air. Life relies on maintenance of oxygen, ambar, piyush, and water in the body. Pranavahaniti Pranasognyaka Vatavahanam Etaccha Pranakya Vishishtastasya. In Charak Viman, the shlok has come. प्राणव स्त्रोतस मूलस्थान मूलमिति प्रभवस्थानम चरक विमान 5 तत्र प्राणवहानाम स्त्रोतसाम हृदय मूलम महास्त्रोतश्च. मूलस्थान means the developmental space. It have hruday, mahastrotas, and rasavahini dhamni, according to Sushrut. Aim to understand the causative factors which are leading to COPD, and objective to evaluate the efficacy of Ayurvedic treatment in COPD with special reference to the lung function test, which we have just seen, which we can diagnose through this spirometry to improve overall health of the individual. Review of literature from Ayurvedic classical literature from Charak Sahita, Sushrut Sahita, Ashtang Hruday. Material and method. Yukti Vyapashray, that is Yojana, what we can give the treatment like Sitopaladi Churna first. It is a common Ayurvedic remedy used in almost all types of respiratory diseases. It provides strength to the lungs, it eases breathing and reduces wheezing and chest congestion. It helps alleviating inflammation of linings of bronchial tubes. Vasa or Adusa, Latin name is Adathoda vasica. It is a good remedy for reducing associated infections and easing breathing. It is beneficial when sputum is thick, white, yellow, or greenish. Pushkar Mool, it is a good remedy for COPD breathing troubles and wheezing. It is beneficial for reducing wheezing and chest congestion. Mulethi licorice is used when patient has trouble in coughing up sputum and suffers with dry cough. It has some soothing effects on the lungs and rectifies the mucus production. It is more beneficial if you have yellow or greenish sputum. Shwagandha, Withania somnifera, is generally given to all patients with COPD due to its rejuvenating and strengthening effects. It reduces tiredness, frequency of breathing troubles, and cough attacks. Abrak Bhasma, to stop further damage to the lungs and control mucus production in the lungs. It is beneficial when there is no problem in expelling out sputum from the lungs and sputum is thin. Caution, you should not use Abrak Bhasma if you have trouble in expelling sputum and excessive wheezing is present. It may worsen the condition. It is only used when there is no thick sputum present in the lungs. Otherwise, it can dry up the thick mucus in the lungs and cause more breathing trouble. Nidan Parivarjan, avoid the etiological factors. Shodhan, biopurification can be performed regularly to capture and biologically degrade the pollutants. The therapy helps in drying up excess mucus secretion in the respiratory system, which can cause obstruction. Additionally, the Nasi therapy can prevent the membrane lining, the nasal cavity from coming in contact with irritants or pollutants. Ahar, a healthy diet which is low in saturated fat and rich in fruits and vegetables. Whole grain foods is recommended. It is beneficial to consume vegetables which are pungent, salty, hot, and light, such as gourd, bottle gourd, spinach, methi, garlic, ginger, bitter gourd, sponge gourd, drumstick, and pulses like green gram, horse gram. Pranayam in COPD. Various studies shows that pranayam has been demonstrated as useful for individuals with moderate to severe COPD. Significant improvements in the IA-SCAT score after 3 months of practice suggests that pranayam can improve the subjective experience of health, disease severity, and functional status for COPD patients. Some asanas like Sukhasan, an effective yogasan to handle lung anomalies, provides lung with fresh blood and remove all toxics from lung muscles. Bhujangasan gets good stretch to lung muscles and allows to get rid of asthmatic symptoms. Padma Sarvangasan allows more air to reach lungs. Result and conclusion, while COPD is commonly treated through medications such as bronchodilators and antibiotics, depending on the severity of the condition, Ayurveda plays a significant role in management of this condition. Ayurveda ensures effective COPD treatment, but requires one to do Nidan Parivarjan that includes modification of lifestyle and diet, and Shaman, pacification treatment, and Shodhan, which is a biopurifactory method technique. Thank you.
Thank you, doctor. Next is a poster presentation, doctor.
Sir, can you share my poster, please?
Okay, 1 minute, doctor.
So should I present my poster after some time?
Doctor, I will share with Doctor. 1 minute, Doctor.
Okay, sir. Okay.
So is this your poster, Doctor?
Yes, sir.
Okay. Please continue, Doctor.
Okay. My poster presentation topic is blood transfusion and its complications. Lesson content, whole blood and blood components. What is blood transfusion? It types, indications, pre-transfusion testing, transfusion reactions. It includes classification, causes, clinical features, and investigations. Next slide. Whole blood and blood components. 350 ml or 450 ml of blood is collected from a donor into a plastic bag containing an anticoagulant. This is called the 1 unit of whole blood, and whole blood can be used as it is or is separated into blood components. Types of blood components: red blood cell concentrate, packed red blood cells, platelet concentrate, fresh frozen plasma, and cryoprecipitate. So next 2 slides are proper, sir. 6th slide. Okay, so this is the image showing how the blood is collected. Next slide, sir. The whole blood for severe blood loss, like it includes red cells, plasma, white cells, and platelets. For surgical and trauma patients, as well as people with anemia, such as anemia 1 and dialysis patient, red cells can be stored for 42 days. White cells to help fight infections. Plasma to treat victims of burn, shock, or dehydration. It can be frozen. Platelets they're given to help treat leukemia patients and cancer patients who are undergoing the chemotherapy. Platelets only last for 5 days. Next slide, sir. Blood transfusion, transfer of blood or blood components from one person into another person. Here is the image showing of the donor. Here is also one image. There is a okay, sir. Types of blood transfusion: fresh blood transfusion, blood less than 24 hours old from the time of collection. Autologous transfusion, blood collected from a patient for retransfusion at a later time into the same individual. Third type is massive transfusion. Number of units transfused in a 24 hours period exceeds the recipient's blood volume. And the fourth type is multiple transfusion, repeated transfusion of blood over a long period of time, months or year. Indications of blood transfusion: the whole blood, acute blood loss, shock, exchange transfusion in neonate, packed red blood cells, chronic severe anemia, leukemia, thalassemia, and platelet concentrate, thrombocytopenia, bleeding due to platelet dysfunction, malignancy, and major surgery. Indications: fresh frozen plasma, like in liver disorders, DIC, coagulation factor deficiency, factor 5th and factor 7th, cryoprecipitate, in the condition like hemophilia A, von Willebrand's disease, and fibrinogen deficiency. Pre-transfusion testing, ABO and RH-D blood grouping, patients and donors blood sample, cross-matching of blood sample, major cross-match, patient's serum plus donor cells, and minor cross-match, patient cells plus donor serum. Here is the image showing the blood grouping. Next slide, sir. Next slide, sir. RH factor, proteins, antigens occurring only on surface of RBCs. RH factor occurs only on the surface of RBCs. RH plus if proteins present, RH negative if proteins absent. A plus, A minus, B plus, B minus, AB plus, AB minus, O plus, O minus. These are the blood groups. Most important for pregnancy: inheritance is autosomal dominant. 15% Caucasian population are RH negative. During pregnancy, the mother and the fetus have different RH protein factors. This condition is called RH incompatibility. Like our blood type, we inherit our RH factor type from our parents. Most people are Rh positive, but a small percentage of people are Rh negative. Rh factor doesn't directly affect the health. However, Rh factor becomes important during pregnancy. Rh disease. Rhesus disease is a condition where antibodies in a pregnant woman's blood destroy her baby's blood cells. It's also known as hemolytic disease of the fetus and newborn, HDFN. If the mother is Rh negative and her baby is Rh positive during pregnancy, some of the fetuses Rh positive red blood cells may get into the mother's bloodstream. Sensitization, the process in which mother's body will try to fight them off by producing antibodies against them. Symptoms, Rh incompatibility can cause symptoms ranging from very mild to deadly. In mildest form, Rh incompatibility causes the destruction of RBC. There are no other effects. After birth, the infant may have yellowing of the skin and white eyes, just the condition like jaundice, low muscle tone, hypotonia, lethargy, swelling or edema, hydrops fetalis. Pre-transfusion testing, screening for transfusion transmitted disease. HIV 1 and 2, it indicates AIDS. HBs AG indicates hepatitis B. HCV, hepatitis C, Treponema pallidum in syphilis, and Plasmodium species in malaria. Adverse effects, transfusion reactions. The transfusion, okay, so causes of transfusion reactions, clerical errors, inadequate labeling, wrong blood issued, technical errors, error in blood grouping and cross-matching, incorrect interpretation of test results. In others like blood contamination during a phlebotomy, blood infusion through small bore needle, blood cooler to -30°C or warm to greater than 42°C, concomitant administration blood and drugs through common set. Clinical features, fever, AG to AB cytokine, IL interleukin 1 fever, Riger cytokines, pain at infusion site cytokine, hypotension, neuroendocrine response, hemoglobinuria, oliguria, anuria. Laboratory investigations rule out the clerical errors, identify the blood sample, compare plasma color on patients' pre and post transfusion sample. Pink, free HP, that is red cell destruction, yellow, increased bilirubin. Check blood color of bag and attached tubing. Purple color or clot in black, it indicates bacterial contamination, and the color change indicates hemolysis. Laboratory investigations, repeat blood grouping on patients and donor sample, repeat cross-matching, perform direct antiglobulin test, blood smear and culture. Others, post-transfusion sample like antibody screening, serum bilirubin, free hemoglobin. Transfusion reaction investigation record. Maintain the patient's particulars, blood bag details, regrouping results, recross matching results, red cell antibody screening results, urine investigations, myobacteriological results, and the signature of the technician in charge. So, summary, blood transfusion, what was this? Types, indications, pre-transfusion testing, transfusion reactions record, clinical features, causes, and lab investigations. Thank you.
Thank you, Doctor. Next, I invite Dr. Gauri Dharmendra Sharma for the paper presentation. Dr. Gauri, are you there?
Yes, sir.
Okay, Doctor. I will share for you, Doctor.
Thank you.
One second, Doctor.
Yeah, sure.
Doctor, please start the session, Doctor.
Good evening, everyone. Myself, Dr. Gauri Dharmendra Sharma from Yela Medical College, guided by Dr. Mayura Devadiga from Prasuti Tantra Evam Stri Rog Department. Title of my presentation is Soma Rog, a conceptual study. Next slide, please. Introduction. Fluids maintaining the body, simply termed as Som. Som also means white or moon. Som Rog is a disease in which the amount of fluids or body fluids or Som is decreased, mentioned in Sharangar Samhita, Bhavaprakash and Yogratnakar. These fluids oozing out from their normal places proceed towards urinary passage and gets expelled, termed as Som Rog. Next slide, please. Nidan. Nidan is mentioned in Bhavaprakash Chikitsa Sthan 69/1. They have said Srinam Ati Prasangena Shokachapi Shamadapi Abhicharika Yodva Gara Yoga Tathaivacha Apa Sarva Sharirastha Kshubanti Prasavanti Cha Tasyatah Prachutyaha Sthanam Mutramarga Vrajanti. Next slide, please. In this, they have explained the causes of Somarog. It means excessive coitus, that is Ati Sri Prasang, grief, shok, exercise, extreme exercise, that is Shram, magical spell, Abhicharika or Mantradi, use of purgatives, toxic or poisonous substances. Next slide. Etiopathogenesis of Somrog is Nidan Sevan. After the seven of causes, the fluid situated in various parts of body of woman gets irritated and discharged. This fluid oozing out from their normal places proceed towards Mutra Marga, that is urinary passage. Next slide, please. The Lakshanas, these are mentioned in Bhavaprakash Chikitsa Sthan. I have elaborated in next slide. Next slide. Clinical features. Clear, pure, cold, odorless, painless, white fluid in excessive quantity through urinary passage is expelled out. Excessive weakness, cannot withhold the urge of passing it. Restlessness, her head become lax or drops. Dryness in mouth and palate. Next slide. Yawning, delirium, excessive dryness of skin, unsatisfied with leakables, eatables and drinkables, unconsciousness. Next slide. Differentiation with Shvetapradar. So the basic difference between the Shvetapradar and Somrog is Shvetapradar is simply white discharge per vaginum. It is not mentioned in Bruhatrayi, but wherever it is mentioned, they have said it is a discharge through vaginal passage, whereas Somrog is discharge through urinary passage. Etiopathogenesis of both the conditions are entirely different, which are explained below. Next slide. Somarog is a discharge through urinary passage, whereas Shvetapradar is discharged through vaginal passage. The fluid of body is responsible for its maintenance is lost in Somarog. In Shvetapradar, whole body fluid has no relation with this disease. In Somarog, woman is unable to control the urge of passing Som, whereas in Shvetapradar, it is an involuntary discharge. So the question of feeling of urge doesn't raise. Unsatiated with eatables, leakables, and drinkables associated with excessive weakness is seen in Somrog, whereas in Shvetapradar, mild weakness can be observed, but there is no such symptom as unsatisfaction with food, water, etc. Next slide, please. Complication of Somarog. In chronicity of Somarog, Mutra Atisar develops with the lapse of time when Somarog becomes chronic. Woman passes excessive quantity of urine repeatedly in association with other clinical features of Somarog. Then it is called as Mutra Atisar. The woman also has loss of strength and energy. Next slide. Ardhamalla has mentioned that due to similarity in vitiation of fluid, few persons consider Mutra Atisar as classification of Somarog. Here also the woman will develop loss of strength and energy. In this disease, small quantity of urine is repeatedly discharged without any pain, discomfort and burning sensation. Next slide. In Chikitsa, the Bhavaprakash Chikitsa Sthan, they have mentioned Kadali Nam Phala Pakwa Dhatri Phala Rasam. I have elaborated the Chikitsa. Please skip 2 slides. Yeah. Kadali Pakwa Phal एवं धात्री फल स्वरस with madhu or sharkara, mash, madhuk and vidarikanda churna with madhu and sharkara along with dugdha, padavas churna with tel for 7 days, chakramarda mool with tandulodak in morning cures somaro, kadalikanda ghrut. Next slide. Rasas. Parad is boiled with Kushmanda swaras until the jal is evaporated. Mixed with Gandhak and Kajali is prepared. Further, Marich is mixed. In Bangeshwar Ras, The surpassed Rasayan preparation by Nagarjun, they have said Vanga Bhasma, Kanta Loha Bhasma and Abrak Bhasma along with Hema Pushpa is taken in same quantity and Grit Kumari Swaras Bhavana is given for 7 days. It cures all 20 Pramehas as well as Mutra Kritsha, Somrog, Pandu and Ashmari. Next slide please. Mutrastisa treatment, powdered Talakanda, Kharjur, Madhuk and Vidarikanda in equal quantity mixed with sugar and honey cures Mutratisar. Root of Chakramarda with Tandulodak. Kadalikanda Grit and Rasa is prepared with Parad etc. Described under number 1 of Rasas for Somarog is also beneficial. Next slide please. Modern correlation. Somarog, though it is difficult to establish exact congruence of Somarog with any disease yet, on the basis of description, it can be said that Somarog is actually Prameha afflicting woman, probably diabetes insipidus due to deficiency of ADH, that is antidiuretic hormone from posterior pituitary, can be correlated with Somarog. Next slide please. This is the description of diabetes insipidus. Next slide. So simply diabetes insipidus is recently named as arginine vasopressin deficiency and arginine vasopressin resistance. That is the ADH hormone, antidiuretic hormone gets deficiated. It is not produced in normal quantity by posterior pituitary causing diabetes insipidus. It is a condition characterized by large amount of dilute urine and increased thirst. Amount of urine produced can be nearly 20 liters per day. Onset can be at any age. Medication includes desmopressin, thiazide, and aspirin. Its complication may include dehydration and seizures. My references are as follows. Thank you so much.
Thank you, Doctor. Next, I invite Dr. Pallavi Yeshwan Molvatkar for the paper presentation. Dr. Pallavi, are you there?
Yes, ma'am. Am I audible?
Yes, Doctor. You can share your screen.
Is the screen visible?
Yes, Doctor. Please start.
Hello, everyone. Myself, Vidya Pallavi Malvatkar, from Poddar Ayurveda Hospital, doing MD in Panchakarma second year. My guide name is Vidya Seema Bhatkar, ma'am. Topic of my today's paper presentation is management of chronic shoulder joint dislocation, a single case study. A female patient aged 62 years came to Panchakarma OPD of our hospital with the following symptoms: Dakshin Amsa Sandhi Shul, Shoth and Kriya Alpata since 2 years, and Dakshin Amsa Sandhi Bhramsha on and off, which was easily during sleep. This was also since 2 years. The history was of fall on right shoulder 2 years back. In the MRI dated 24th November 2020, there was 1.6 by 1.5 centimeter wedge-shaped heel-shaft lesion in superolateral humeral head without marrow edema. Discrete anterior labral tear was there, and as the heel-shaft lesion was not that bigger, it was smaller. It had non-engaging morphology. There was supraspinatus and anterior infraspinatus insertional tear. There was grade 2 fatty infiltration of supraspinatus and infraspinatus muscle, moderate superior subscapularis tendinosis and bicipital tendinosis. Now, what is the heel-shaft lesion? In heel-shaft lesions, there is a dent in the back of humeral head, which occurs during anterior shoulder dislocation as humeral head impacts against the front of glenoid cavity of scapula. The larger the heel-shaft lesion is, the more likely that glenoid labrum and joint capsule have significant tear. Now here in this case, the heel-shaft lesion was very small, but it also had the labrum tear. This is the image showing the heel-shaft lesion. The small in this case, the lesion was small, that is only less than 20%, and usually it is treated non-operatively. Medium size lesion is generally 25% and larger size is greater than 40%, which needs operative. But in this case, the doctor had suggested them operative, but also the patient was not willing for the operative, and there was not only the heel-sized lesion, but also there was subscapular tendinosis and labral tear. So the patient, they were not willing for operative because the success rate was also not that good. The chikitsa given was Bhaya chikitsa, Snehadhara with Balaguduchadi Tel, followed by Mrudu Samvahan, and Upanaha with Bajranga Lep plus Yashti, Manjishtha and Arjun. Then Bantha was applied and it was removed in the next morning. This was done for continuous 7 days. Then Abhyanta chikitsa given was Trayodashanga Gugul and Ashwagandha Ghana, Maharasnadikvat and Ratra Vartaki Churna for Anuloma. In the first follow-up, shoulder joint pain reduced by 5%, no episode of shoulder joint dislocation since 15 days, and not much improvement in right shoulder joint movement. In the second follow-up, shoulder joint pain was reduced by 10%. There was no episode of shoulder joint dislocation, and there was improvement in shoulder joint movements. In the third follow-up, Shrishti Pindasved was given to strengthen the Mamsa Dhatu, Asti Dhatu, and Snayu. For the Shrishti Pindasved, Quat prepared was by using Manjishtha, Guduchi, Yashti, and Shatavari. Siddha Kshir was prepared from this, and then Shashtrishali was cooked in this Kshir, and Pindasved was done for 7 days. After 7 days of treatment, patient showed good improvement in range of motion, and pain was reduced by 40%. And there was no, again, any episode of shoulder joint dislocation. Now, why Balaguduchadi Tel was used here? It contains Bala, Jatamansi, Chandan, Guduchi, Devdar, but also it contains Shallaki and Gandhavirosa, which are Niryas, that is the gum, which will give strength to the muscles, the Mamsa Dhatu and Snayu. Bajrang Lep was given. Bajrang Lep contains Amra, Ridra, Shallaki, Fitkari, Gairik, Lodhra. These all are Kashaya Rasatmak, Kashaya Tikta Rasatmak, and they help in wound healing, and they're also Sandhankar. So also Yashti, Manjishtha and Arjun were added to enhance the Sandhankar action by doing Rakta Prasadan and giving bal to Snayu and Mamsa Dhatu. Trayodashanga Gugul was given, which is also used in Sandhigatavat, Asti Majjagatavat, Snayugatavat, and Asti Bhagna. It also contains Abha, that is Babbul, which is also a gum, and hence all this, if you see in all the three, Niryas is the main content, that is Shallaki, Babbul, and Gandhavirosa. They all help in doing Sandhan of the dhatus which have been affected. Thank you.
Thank you, Doctor. Next, I invite Dr. Anjana Ashok for the paper presentation. Dr. Anjana.
Yes, ma'am. Am I audible?
Yes, Doctor. Please start.
Okay. Good evening, all. My name is Dr. Anjana Ashok. The topic of my presentation is radiological investigation of urinary system.
Excuse me, Doctor. Where is your PPT? Please share your screen.
Is it visible, ma'am?
Yes, Doctor.
Okay. So my topic of presentation is radiological investigation of urinary system. Starting with the introduction, urinary system consists of kidney, ureters, urinary bladder, urethra, and prostate. And in the modern era, there are a lot of investigations like laboratory investigation, different imaging techniques for diagnosis of different conditions. And today I'm going to present before you the radiological investigation. The first one is straight X-ray. Unlike the X-ray we take for the screening of bones, in urinary system X-ray, we have to prepare the patient prior to the examination. So for the preparation, at least 6 hours before the examination, we have to keep the patient nil orally, and usually a purgative is given the night before, and the plain film of the abdomen is taken, including the kidney, urethra, and bladder region, which is mentioned as KUB region. And from this straight X-ray, we could find out different parts of the urinary system. And the first thing we can infer is about the kidney. From the kidney, we can assess the size, and a normal kidney extends from top of L1 vertebrae to the bottom of L3 or middle of L4 vertebrae. And in 90% of cases, the right kidney is lower than the left due to the displacement by the liver in the right side. And also we could find out congenital absence or renal agenesis, and unascended kidneys or ectopic kidney is a condition where the kidney is found slightly higher, lower, or in the opposite side of its original position. And also we could find out any enlargement of the kidney, which may be due to hydronephrosis, polycystic disease, or renal cancer, and in presence of localized swelling like carbuncle, tubercular cyst, simple cyst, or tumors can be found from the straight X-ray. Next, the major finding from this investigation is the presence of urinary calculi or stones. Majority of the urinary calculi, which are radio-opaque, can be seen through the straight X-ray, except the pure uric acid stone, which is radiolucent. And it is very difficult to assess the exact position of the stone through the straight X-ray. But if we take a lateral view of the urinary tract with a radio-opaque dye, then it will allow us to correctly locate the position of the stone. And whenever an opacity is identified in a straight X-ray of KUB region, we have to differentiate it from the following conditions. The major differential diagnosis of a renal calculi is a gallstone. Next is calcified lymph nodes, then calcified costal cartilage, then phlebolith, which is a condition in which multiple round calcified densities with radiolucent centers that form in a person's vein. So phlebolith are basically the calcifications present in a vein, and these have a peculiarity that they are radiolucent in its center, that we can see a black spot in the central part of that opacity. From this, we can differentiate it from the renal calculus, as you see in the picture. And we have to differentiate it from calcified aneurysm of the abdomen, abdominal aorta or renal artery, then like small calcific bodies in the subduction of kidney. A stone in the appendix or a fecalith in the colon may also be confused with a stone in the ureter. And the main characteristic of a renal stone is that it moves with respiration. This can be identified by taking two X-rays, one in deep expiration and one in deep inspiration. Comparing the two X-rays, we could find out a change in the position of the calculi or the opacity. Then we can confirm it as a renal calculi. And the major difference between a renal calculi and gallstone is that a renal calculi is uniform in density. That is, it will be presented as white opaque in all its area, but a gallstone will be less dense in its center. That is, there will be a grayish or black spot in the central part. And if the renal calculi is present in the renal pelvis or calyces, then it take up the shape of that pelvis and calyx. Whereas gallstones, if present in solitary, is round in shape, and multiple gallstones will be fused in the gallbladder and become faceted, like that, it having different sides. And the major difference between these is in lateral view, a renal calculi will always lie superimposed on the shadow of the vertebral column, but a gallstone will be seen in front of the vertebral column. As you see in the first picture, the urinary calculi is seen as superimposed in the vertebral column, whereas in the picture at the right side, gallstone is seen anterior to the vertebral column. Next is ureteric calculi, which is usually oval in shape because it lies in a hollow tube, and it always lies in the line of ureter. Line of ureter is an imaginary line which is drawn through the tip of the transverse process of vertebrae, traversing the sacroiliac joint and ischial spine, and then deviating medially. And a vesical calculi that is present in a bladder should always be differentiated from a prostatic calculi. A vesical calculi is always seen just above the symphysis pubis, as you see in the first picture, and a prostatic calculi always appear as small dot behind the symphysis pubis, as in the second picture. These are about the stones. Next is the psoas shadow, which is a finding from a normal KUB X-ray. Psoas shadow is the shadow of psoas muscle, which is normally seen quite distinctly. But in some conditions like perinephric hematoma, abscess or cold abscess, due to the collection of a fluid, the psoas shadow.
Excuse me, doctor.
Yes.
Doctor, you are exceeding the time limit. Doctor, can you speed up your presentation?
Okay, sir. The psoas shadow won't be seen in the in conditions like these. And also we have to detect bones for any arthritic changes or presence of metastasis, which may mimic the renal pain. And next is the urography. Urography is the examination for the kidney, ureters, and bladder, and it is performed using conventional X-ray after the administration of a radiographic contrast material. And here the important advantage is that we could see the pelvis and calyces distinctly. And we can also do renal angiographies where contrast material is injected into the arteries of renal arteries and renal veins. And findings like aneurysm, stenosis, vasospasm, arteriovenous malformation, thrombosis, occlusion, and presence of tumors can be found out. And next is lymphangiography. Here, a lymphatic vessel is cannulated and the oily contrast material is injected, and this leads to the opacification of the different groups of lymph nodes. And this is important when there is a metastatic infiltration, and it can be seen as filling defects. Even though there are advanced imaging techniques, radiology is a commonly used investigation, and we shouldn't miss such investigation techniques. And thank you.
Thank you, doctor. Next, I invite Dr. Sandeep for the paper presentation. Dr. Sandeep.
Yes, madam. 1 minute.
Okay.
Yeah, madam. Am I visible? Am
yes,
I my
yes,
PPT?
doctor, visible, doctor.
Okay. Thank you, sir. Okay. A very glad good evening to everyone. So I am myself Dr. Sandeep from Rashastra and Vaishajya Kalpana Department from Hassan, SDM Hassan. So I start my presentation with welcoming everyone. So my topic is role of Parpati Kalpanas in therapeutics. So as coming to the introduction part, so the term Parpati is derived from the root word Parpata, which means papad. That is, the every Parpati preparation is like a papad. So it is derived from the root word. So then coming to synonyms, it is named as Parpata, Parpati, Parpatika, and several others. Next, as the Parpati Kalpana is one of the Visishta formulation mentioned in several rogas by several authors in many classics. So coming to these Kalpanas are named mainly on the basis of the end product appearance, that is the papad shape. So it is called as Parpati. So next, coming to most of the Parpati Kalpanas are indicated in Grahani Roga. In fact, mainly the first reference of Parpati is seen, is mentioned by Acharya Nagarjuna in Rasendra Mangala, that is 8th century. So as there is a little controversy of about the author, so the latter explained about explained references the Chakradatta in 11th century. So it is taken as authentication of first explaining. So after that, many acharyas like Vangasena, the author of Rasaratna Samuchaya, Rasendra Sarasangraha, have significantly explained about Parpati Kalpanas. Coming to the types, there are mainly two types of Parpati Kalpanas. One is Sagandha Parpati Kalpana and Nirgandha Parpati Kalpana. So these two types of Parpati Kalpanas are mainly named with the presence and absence of the Gandhaka. Coming to Sadhana Parpati, that is example, Rasa Parpati, Loha Parpati, Shweta Parpati, Vijaya Parpati, Gagana Parpati and Tamara Parpati. Next, coming to Nirgandha Parpati, Shweta Parpati and Malla Parpati. Next, when coming to the explanations on different types of Parpatis, the mainly explained Parpati is Rasa Parpati, about which is mentioned by Rasa Tarangini 60 as 6th chapter. So why only Rasa Parpati means Rasa Parpati consists of less ingredients, easy to prepare, and with more economic way. So I explained Rasa Parpati here. There are many Parpatis explained in different classics. Among them, the most economically and easily prepared is Rasa Parpati. Rasa Parpati mainly consists of Parada and Gandhaka, and it is prepared with the normal basis of the preparation explanation, which is explained in the classics. During the preparation, the mainly noted thing is the Paka which the Parpati gets. That is mainly it consists of Mrudu, Madhyama and Karapaka. The main Mrudu and Madhyama Paka obtained Parpati is very effectively used for therapeutics. So coming to the guna of Rasa Parpati, it is Sarva Grahani Roga Nashaka, Kshayanashaka, Kasanashaka, Jalodaranashaka, Gulma, Daha, Jwara, Shota, Kamala, Arshas. How could these rogas can be these roga nashana is done by only one Parpati is, that is the roga yukta anupana can be matched with the Rasa Parpati and it is given widely. So according to the anupana which is given, the roga can be subsided sequentially. So coming to the matra of Rasa Parpati, the matra is 2 Ratti. The dose of the Parpati mainly varies from therapy to therapy and roga to roga accordingly. The Samanya matra of Parpati is 2 Ratti. 2 Ratti. Then Visishta matra extends from 10 to 12 Ratti. Coming to the Parpati Prayoga, that is Rasa Parpati Prayoga, there are wide range of diseases which are given with Rasa Parpati. That is among them I have selected a little and I have placed here. So Rasa Parpati when given with Rasna Mula, it is Unmadahara, and Rasa Parpati when it is given with Brahmaiswarasa, it is Apasmar Rogara. Rasa Parpati given with Shuddha Gugulu, it is Panduroga Nashaka, and Rasa Parpati given with Nimbachurna, it is Sarva Kushtahara, and Rasa Parpati with Trikatu Churna is Kafaja Kasa Nashaka. So based on Anupana, if Rasa Parpati is given, along with it, it can widely cure the disease. So coming to the Bola Parpati, so I have mentioned the Parpati yogas which are practiced widely nowadays. So and I have made the description very short, as there are we can. So another Visishta Prayoga of Parpati Kalpana which is practiced is Bola Parpati. The ingredients used here is Shuddha Bola, Shuddha Parada and Shuddha Gandhaka Churna. The dosage of the Parpati varies from 3 to 6 Ratti, and it is widely given in Rakta Pitta, Rakta Arshas and Raktaja Yonisrava. So its main action is styptic and to arrest any of the bleedings from the Adhogata Roga Marga. So we can widely use this Bola Parpati. Next, coming to Loha Parpati. The Loha Parpati is also widely used in Grahani Roga and it is said by Vaishajya Ratnavali Kara. the ingredients used is Shuddha Parada, Shuddha Gandhaka, and Shodhita Loha Bhasma. The matra of Loha Parpati varies from 1 to 14 Rati. So this is a Visishta Prayoga which is done on the basis of Rasaushadis. So the 14 Rati Pramana of is not explained in another Rasaushadis. So in Rasaushadis, when given as therapeutics, the dosage mentioned is very low. But when coming to Parpati Yogas, the dosage extends up to 14 to 15 Rati in some Visishta Yogas. So coming to the Loha Parpati Upayoga, that it is used in Sutika Roga, Jwara, Asadhya Grahani, Amadosha, Shula, Atisara, Pandu, Kamala, Bhasmaka Roga, Udavarta, Kushta, and Stavara Visha and Jangama Visha. Coming to the Panchamruta Parpati, more than Loha Parpati and Bola Parpati, Panchamruta Parpati is used more. So the Dravyas, and it is one of the most important yoga mentioned in Rasa Yoga Sagara. The ingredients used is Shuddha Parada, Shuddha Gandhaka, Loha Bhasma, Abraka Bhasma, and Tamra Bhasma. As the 5 ingredients are mentioned, so it is called as Panchamruta Parpati. Coming to the Matra, it is 2 to 8 Rati, varies from 2 to 8 Rati. It is given more in Grahani Roga, Aruchi, Atisara, Arshas Chardi, Purana Atisara, Jwara, Raktapitta, Kshay Roga, Vali Palita, and Netra Roga. And one more thing about Panchamruta Parpati is in Falashruti it is explained that Varshe Jiva Shatam means the Rasayana property which is attained is more in Panchamruta Parpati. When a person should live up to 100 years, the Rasayana property should be more enriched in that particular preparation. So Panchamruta Parpati have more of Rasayana Guna. Next, coming to Pathya. The Pathya which is explained here is general to all Parpati Kalpanas, that is Kakamachi, Patola Patra, Puga Phala, Ardraka, Vatsuka. So these are can be consumed. And Kadali Pushpa, Krishna Vruntaka, that is black color brinjal. Next, Purana Shali should be consumed, and Kshira Gruta should be consumed during the intake of Parpati Kalpanas. Next, coming to Apathyas, that is Shita Jala, Shitaja Vihara.
Hello, Doctor.
Aji.
Doctor, you are exceeding the time limit, Doctor. Can you speed up your presentation?
Okay, sir. Only one slide more. Okay. Next, in Kopa and Chinta, the Parpati should not be consumed. And during the consumption of Parpatis, Nimba Patra, Nimba Bija, Tikta Dravya, Guda, Pakshi, Mrugamamsa should not be consumed, and it should be done strictly Varjya. Coming to the Samanya and Visishta Prayoga of Parpati, the Samanya Prayoga comes from 1 to 2 Rati, and it is practiced in OPD levels, and it is with Anupana, suitable Anupana of Roga, it can be given with specific disease. Next, coming to Visishta Kalpana of Parpati Prayoga, the Parpati Prayoga varies from 1 to 10 Rati, and it is given in Vardhamana Prayoga with daily 1 day increase of 1 Rati. And after the completion of 10 days, the tapering is done with 1 Rati decreasing every day. So Vardhamana Prayoga is usually preferred in Jirna Roga Avastha and Bahudosha Avastha. It is strictly, the Pathya should be strictly done due to the elimination of adverse drug reactions. And it is the Visishta Prayoga, it is practiced in IPD levels, not in OPD levels. At last, thank you everyone.
Thank you, Doctor. Next, I invite Dr. Chandranshu Shukla for the poster presentation. Dr. Chandranshu, are you
Yes,
there?
ma'am. Yes, ma'am.
Okay. Please share your screen.
Okay, ma'am. 1 minute. Is it visible?
Yes, doctor.
Okay. Hello, good evening, everyone. Myself, Dr. Chandranshu Shukla. I am doing my PG in Panchkarma from Dr. D.Y. Patil College of Ayurveda and Research Center. My poster presentation topic is Ayurveda and migraine. The causes of migraine are Vata and Pitta dosha prakop, intake of spicy food, caffeine, tea and coffee, and more screen timings on computer and phones. The symptoms are as severe pain in half part of head, irritability to noise, high sound insensitivity. In Ayurveda, the treatment of migraine is described as in Panchkarma, especially Nashya, nasal drops with Panchendriya Tarpan oil. We can do Agni Karma at Shankh, Marma and Lalat Pradesh, that is forehead. Dhumpan is also helpful, the drugs with Haridra, Vacha, etc. And Virechan is done for Pitta Shaman with Tivrat Leha. Easy ways to reduce migraine is meditate, read books, listen music, eat more fruits, sleep well, avoid stress, no caffeine or alcohol intake, do not control natural urges, that is Veganna Dharyet, do not overthink. Thank you, ma'am. It's all about Ayurveda and migraine.
Thank you, doctor.
Thank you, sir.
Thank you, doctor. Next, I invite Dr. Snehal Navnat Jagtap for the paper presentation. Dr. Snehal?
Yes, ma'am.
Okay, please share your screen.
Can you please share the screen?
Okay,
Okay,
we'll
doctor.
share.
One minute, doctor. Hello, Dr. Snehal. Please start, doctor.
Yes, sir. Good evening, all. Myself, Vaidya Snehal Navnat Jagtap from Government Ayurvedic College, Nanded, Department of Kaya Chikitsa, PG Scholar, guided by Dr. Nakante, sir. Topic Ayurvedic Management of Migraine, a case study. Here we see contain introduction, aim and objective, material and method, result, discussion, and conclusion. Let us see introduction. Migraine is a disorder of neurological system which is associated with strong headache. Migraine is an episodic primary headache disorder in which symptoms typically last for 4 to 72 hours and may be severe. It is usually present as unilateral, pulsating, severe, and sustained headache that is often aggregated by routine daily activity and stimuli. In Ayurveda, migraine can be correlated with Ardhavedak, which is mentioned under Shiroga. References is Shushruta Uttar Tantra 25-15. Acharya Charaka is mentioned Nasya Karma as a baseline of treatment in Shiroga. References Charak Chikitsa Service. Next. Aim is to study the Ayurvedic management in migraine, that is Artha-Vedak, and objectives are to reduce the intensity, frequency, and duration of headache, along with nausea, vomiting, and photophobia. Next. It is a case study. A female patient of age 37 years old came at the OPD of Kaya Chikitsa in our institute. Patient occupation is housewife. Chief complaints are headache involving right side since last 1 year. Severity of headache was increased since last 2 months. Associated complaints were nausea, vomiting, and photophobia are also present. Next. Past history of the patient is known case of hypothyroidism since 4 years and no history of diabetes, hypertension, trauma, and fall. Patient's personal history are diet are mixed, appetite is good, bowel is incomplete evacuation, micturition is normal, sleep is disturbed because of pain, and no any addiction. Next. Then we can do the Ashtoyat Pariksha of patient, where we found Nadi is Vat Kapach, Shabda is Pashta, Mala Asamyak, Sparsha, Anushna Shita, Mutra is Samyak, Druka is Prakrut, Jiva Sam, Akruti is Madhyam. On examination, we see the general condition of patient is moderate and afebrile. RS is air entry bilateral equal and clear. CVS is S1 S2 normal. CNS is conscious oriented. BP of patient is 110/70. Pulse rate is 88 per minute. And all the routine investigation are normal. Next. Samprapti Ghatak, as we found, Dosh is Vat Kafach, Dushya is Rasa and Rakta, Strotasas are involved Rasava, Raktava, Purishva, Rogamarga Madhyam, Agni is Samyak, Adishtan, Shira Pradesh, Vyaktastan, Udva Chaturgat, and Sadhya Sadhyatva, Kashta Sadhya. Next. Nidan Panchak of the patient. रुग्ण हेतूच आर वृक्ष आहार जीवास्वाप अध्यशन अजीर्ण दधी सेवन frequently प्रवात सेवन वेग धारण occasionally and some kind of stress. Purvarup we found are mild headache occasionally. Rupa of the patient is increased duration and intensity of headache along with nausea, vomiting, photophobia. Upashay get by rest. Next. Sampraptis are after Hetu Sevan, Vat Kapha Dosha Prakop is happened, then Stota, as we know, Chikitsa, we treated Vat Chikitsa, Stotas Stan Veguna, Rikta Stotas Vayu Puran, then Shira Pradeshi Sthana Samshre, then patients start complaining Shira Shul, Rullas, Shardi, Prakash Asaishnuta, that is photophobia, then Ardha Vedak is start. Next. Treatment given is Sarvanga Snehan with Tetel for 7 days. Sarvanga Nadi Swet with Dashmurkwat for 7 days. Then Nirva Basti, where Erandamuladi Nirva 760 ml for 2 days, followed by 1 Matra Basti, which is Sarchatil 60 ml, such as 2 cycles were given. Nasya with Bala Bilva Siddha Kshira, 2 to drop per nostril for 7 days. Some Shaman Aushadhi are given in combination, where Suvarna Suchekar 125 mg plus Yogendra Ras 125 mg plus Amal Ki Churno 250 mg. This combination for TDS with lukewarm water before meal for 10 days. Then Trifraquat 30 ml plus Erandus near 10 ml for HS for 10 days. Basti Chikitsa given in below manner, where day 1 and day 2 Nirva Basti, day 3 is Matra Basti, and day 4, day 5 Nirva Basti, and day 6 is Matra Basti. Next. Result and assessment can be done with the subjective criteria, where intensity of headache, frequency of headache before treatment is moderate, that is 3+, and after treatment is mild or least, that is 1+. Nausea, vomiting, and photophobia before treatment moderate, that is 3+, and after treatment mild and least, that is 2+ and 1+. Next. Discussion. Chikitsa of Ardha Vedak involves Snehan, Svedan, Basti Chikitsa, Nasya, Shaman Chikitsa as per Acharya Charaka. Nasya Aushadhi, that is Bala Bila Siddha Kshir Nasya, reaches to head via nasal route and act as a neurological center, whereas Basti Chikitsa pacifies the vitiated Vata dosha in body. Combination of Shaman Aushadhi, that is Suvarna Suchekar, Yogendra Ras, and Amalki act as a neuroprotective, antacid, and Vata Shaman properties due to having Sukshma Srodrogami properties. Conclusion is migraine is an half-sided headache which in Ayurveda closely related to Ardha Veda. Ayurveda believes in cleansing the body and pacifies the three dosha from the root cause. From above case study, it can be concluded that Ayurvedic management is safe and effective for Ardha Veda, that is migraine. Thank you.
Thank you, Doctor. Next, I invite Dr. Apeksha Prakash Powar for the paper presentation. Dr. Apeksha.
Yes, ma'am. Hello.
Yes.
Hello.
Please share your screen.
Sir, can you please share the screen?
Okay, doctor. 1 second, doctor. Hello, doctor. Please start, doctor.
Hello. Good evening, everyone. Myself, Dr.Prajna Prakash Powar, PG scholar of Kaichikista Department of Government Ayurvedic College, Nanded, guided me by Vaidya Prasad Kulkarni, sir. Today's my presentation topic is management of rheumatoid arthritis, Amvat in Ayurveda with a case study. Next, let's see the introduction first. Rheumatoid arthritis, it is an autoimmune chronic inflammatory disease. As the disease progresses, the inflamed synovium invades and damages the cartilage and bones of the joint. According to Ayurveda, it can be correlated with Amvat, in which vitiated Vata doshas carries arm to the multiple organs and joints, causing swelling, pain, stiffness, loss of appetite, and decrease the Agni. In Ayurveda, Rukshan Chikitsa mainly stated in Amvat. It includes Udvartan, Swedan, Basti Chikitsa as a baseline treatment for Amvat. Next, next. The aims and objectives are first, to study the effect of Ayurvedic management in rheumatoid arthritis. Objective, to reduce the morning stiffness, pain, swelling, and loss of appetite. Next, case study, a 42 years old female patient came to OPD of Kai Chikitsa with complaints of morning stiffness, pain, and swelling at both knee joint and loss of appetite since 3 years. Patient had no history of thyroid disorder, history of COVID-19 before 2 years, history of dust allergy. Menstrual history was regular. In the past, she was not a known case of diabetes mellitus or hypertension. Next, Rugna parikshas were done. Nadi was 86 per minute. Mala was a samyak, that is incomplete evacuation was there. Mutra samyak, Jiva sama, Shabda spashta, Sparsha anushnashita, Druka prakrut, Akruti stula, Agni mandya is there. Nidra was samyak. Next, on examination, general condition was moderate, afebrile. RS, air entry bilateral was clear and equal. CVS S1, S2 was normal. CNS conscious and oriented. BP was 110 by 70 mm of Hg and pulse rate 86 per minute. Next, previous slide. Hetus of Amvat given by Acharya Madhavaj. Viruddha ahar cheshtasya, mando agni ani lasya snigdham bhukta vato hi anna, vyayamam kurvatas tata. सामान्य लक्षण given by Madhavaj, अंगमर्दो अरुचि तृष्णा, आलस्य गौरवम जराः, अपाका शूनता अंगानाम, आमवातस्य लक्षणम. Next, संप्राप्ति described by Acharya Madhav, वायुना प्रेरितो हि आमं श्लेष्मस्थानं प्रधावति, तेन अत्यर्थ विदग्धस धमनी प्रतिपद्यते, वातपित्त कफय भूयो दूषित सो अन्नजो रसाः, स्रोतांसि अभिषन्दयति, नानावर्णोति पिच्छिलाः, जनयत्याशु दौर्बल्यं गौरवं हृदयस्य च, व्याधीनाम् आश्रयोश आमसंज्ञोति दारुणः, युगपत कुपितावन्त त्रिकसन्धि प्रवेशक, स्तब्धं च कुरुतो गात्रम् आमवातस उच्यते. Next, treatment given to the patient was Udvartan with Kolkulattadi Churna BD for 7 days, Swedan with Dashmuladi Kwat, that is Nadi Swed BD for 7 days, Vaitaran Basti 120 ml for 3 days, followed by 1 Matra Basti with Brihat Sindhavadi Taila 60 ml. Such a 3 cycles were done. Ajamudadi Churna 5 gram BD before meal with lukewarm water for 10 days. Sihanath Gugur 2 BD after food with lukewarm water for 10 days. Shunti Kwata 30 ml with Eranda Sneha 10 ml HS for 10 days. Valuka Puttali Swedan BD. Next, assessment were done. The changes in observations before and treatments are RA factor before treatment was 75, after it was 33. ESR before treatment is 55 and after treatment it was 35. CRP also before treatment was 50 and after treatment it was 15. Next. There is also changes in sign and symptoms like swelling, pain, stiffness, loss of appetite and temperature. There is mild reduction. There is significant reduction in clinical symptoms of the patient. Next, discussion. As the case discussed was a case of Amvat, mainly Vat dosh was Vikruta and Agni Manja was present. About treatment of Amvat is mainly Rukshan Chikitsa, includes Vaitaran Basti with Udvartan, Nadi Swedan, Nitya Virechan. Swedan was help in relieving the stiffness of joints. Vaitaran Basti, due to its Laghu, Ushna, Tikshna, Ruksha Guna, act as a Srotoshodan and helpful to eliminate the ammo from the body. Ajamudadi Churna having Deepan Pachan properties. Eranda Sneha pacifies the vitiated Vata dosha. And we all know Rogadikar of Sihanath Gugur is Amvat. Next. Conclusion, Amvat can be successfully managed with Ayurvedic Rukshan Chikitsa. In present case study, combined use of Vaitaran Basti and Eranda Sneha gave remarkable relief to the patient with significant reduction in morning stiffness, also pain and swelling of both the knee joint. Patient was advised to follow Patyakar, Ahar and Viha. Next. Thank you.
Thank you, Doctor. Next, I invite Dr. Bhuvana V. Mundargi for the paper presentation. Dr. Bhuvana, are you there?
Yes, sir.
Doctor, please share the screen, Doctor.
Yes, sir. Just a second. So can you please share the PPT if you have, because I'm not able to do it.
Okay, Doctor. 1 minute, Doctor. I will share for you, Doctor.
Sure, sir.
Doctor, please start, Doctor.
Yeah. Good evening, one and all. This is Dr. Bhuwana. So today my topic will be role of Panchakarma in preventive medicine. So as we all know, Ayurveda is a natural healthcare system that aims to achieve good health and well-being through a comprehensive approach addressing Mana, Sharira. Next slide, sir. Mana, Shari, Indriya, Desha, Kala. So some Samadoshas. Samadosha Samagni Samadhatu Malakriya Prasanatma Manya Swasta Ityapi Diyate. So the importance is given not only for the physical entities but also for the mental entities, and the good health is obtained by practicing preventive and personalized medicine. So as we all know, the prevailing busy schedule and the impaired ahara vihara leads to imbalance of doshas in the sharira. Hence it is important to have a systematic approach to the balance of doshas according to the ritus, etc. And in order to achieve the same, so next slide, Ayurveda has advocated certain regimens and treatment modalities such as Dinacharya, Ritucharya, Vegadharana, Rasayana, Vajikana, and Panchakarma. As we all know, Panchakarma is a unique way of cleansing the body and thus keeping the body healthy. Panchakarma or Shodhana is also called as Punarnava Chikitsa because doshas mitigated by Langana and Pachana therapies might sometimes aggravate, but those expelled by Samshodhana will not get aggravated again. So next slide. Panchakarma is again carried out in 3 ways mainly. When it is done for Swasta, it will be like Dinacharya and Ritucharya mainly. So Roganusara Panchakarma and Panchakarma for Rasayanadi, Asadharana and Guna Prakti. Next, moving on to the Ritushodhana. Ritushodhana is followed irrespective of Swasta or Atra in order to prevent the disease as well as in the promotion of health. So Ritucharya is to avoid the complications of Chaya and Prakopa of doshas according to Ritu, and hence Panchakarma mentioned in Ritucharya helps in prevention of the disease. Chodhana is inappropriate seasons helps to expel Sanchita Malas, otherwise further accumulation occurs leading to its aggravation and even causes a threat to life. Next slide, sir. So this will be the Ritu Kriya Kala. Whenever an individual indulges in ahara and vihara which provoke a particular dosha in its aggravated stage may produce respective disorders. So Shodhana is advocated periodically and becomes mandatory to eliminate the aggravated doshas. Depending on the state of the doshas, in each Ritu, Nirharana Kala has been mentioned. So next slide. Aggravated kapha dosha hampers the kayagni, causing metabolic disturbances, and hence Vamana karma is indicated in Vasanta Ritu. Due to Ritu Subhava and indulgence of Amla Rasa Pradhana Ahara in Sharat Ritu leads to Pitta Prakopa, and hence administration of Tikta Rasa Pradhana Aushada for Snehapana followed by Virechana and Raktamoshana is advised in Sharat Ritu. Vata dosha aggravated in Varsha Ritu needs to be eliminated through Basti Karma. Also, Balya and Brahmana Bastis like Yapana Basti is also advised due to the Avarabala. For Swastha Purusha, different formulations of Bastis like Madha Tailika Basti, Balakudichadi Basti are also advised. And Mashanasya is advocated in Pavat, Sharat and Vasanta each year for a week, alternatively in the dosage half pala. Moving on to the different regimens for prevention. So other than the explained ones, there are certain other methods to be followed, which include the Dinacharya and Vegadharana. Here, Vegadharana refers to the dharana of the dharana of the adharaniya Vegas. So other than, following Panchakarma and allied procedures like Anjana, Navana, Nasya, Pratimasha Nasya, Dhumapana, Kavala Gandusha will prevent different diseases. Prayogika Dhumapana is advised to combat aggravated Vata and Kapha dosha. Next slide. Abhyanga is advised as Dinacharya to prevent aging, activating sense organs and improving overall quality of life. It can be performed over the Shira, Shravana, Pada and Sarvanga. Shirobasti, as we all know, is one of the Mudni Tela advocated in a healthy person for about 1000 Matra Kala, which helps to prevent the Urdhva Chaturgata Vikara. Udvartana is specially indicated in Staulya for Meda Vilayana and in others help to improve Varna, Kanti and Twacha. Suppression of natural urges are contraindicated as they may result in grave complications. And such complications can be treated very well by Panchakarma. For example, Avapidaka, Snehapana, Virechana and Basti are considered best in treating these. Rasayana and Vajikarna and Panchakarma. So next slide. Rasayana and Vajikarna are unique treatment divisions which have a greater role in the prevention of diseases as well as promotion of health. Panchakarma or Shodhana procedures is mandatory prior administering these drugs, hence because their effect is enhanced if performed after Shodhana. For example, Agasya Haritaki Rasayana administered after Shodhana in the management of Mukha not only reduces the symptoms significantly but also improves the quality of life. Ashwagandha Churna given after Shodhana improves the quality of life and Shukra and helps in getting healthy progeny. So coming to the discussion. Shodhana improves Kayagni, cures the disorders and maintains the equilibrium of doshas, improves Varna and Kanti and Buddhi. It also improves the vigor and vitality and enables the person to live a long and healthy life. Vamana, properly conducted Vamana, especially in the month of Vasanta Ritu, removes the aggravated kapha and also makes the body light, improves functions of Indriyas and clears the shrotas of chest, flanks and head region. Virechana, properly conducted, removes the aggravated pitta and clears all the shrotas in the sharira. Jhataragni also kills kundalini and lightness sets in. Basti, properly performed, establishes proper expulsion of Purusha, Mutra and Vata, increases appetite and taste. Nasya, when properly performed, removes the aggravated doshas heated above the Urdhva Chatur Pradesha and clears the channels of circulation. Coming to the conclusion. Therefore, Shodhana is a process by which vitiated doshas are eliminated by means of Niroha Basti, Vamana, Virechana, Nasya and Rakta Mokshana. Shodhana can be adopted for both types of prevention, that is primary and secondary prevention. When it comes to primary, in which the strategy is intended to avoid the development of disease, and secondary, in which the strategy attempt to diagnose and treat an existing disease in its early stage before the morbidity. Success of Shodhana usually depends on the properly performed Purva Karma, Pradhana and Paschat Karma. Improperly administered Panchakarma may lead to many complications like Shota, Kushta, etc. Thus, Panchakarma plays an important role in prevention of disease and also for curing the existing disease, thereby maintaining good health. Thank you.
Thank you, Dr. Bhuvana. Next, I invite Dr. Prathanya Arun Marathe.
Dr.
Hello,
Prathanya Marathe, are you there? Hello, Dr. Prathanya Marathe, are you there? Doctor, please unmute, doctor. We can't hear your voice, doctor.
Hello.
Hello. Yes, doctor.
Hello. हाँ sir. एक minute.
Okay, doctor.
May I start,
The
sir?
screen is visible, doctor. Please start.
Okay, thank you. Good evening, everyone. My name is Dr. Prajna Arun Marathe, PG Scholar of Rognitan Department, Government Ayurvedic College, Nanded. So today my topic of presentation is laboratory investigations in diabetes mellitus. So what is diabetes mellitus? It is metabolic group of disorders characterized by persistent hyperglycemia due to deficiency and or diminished effectiveness of insulin. So there are derangements of carbohydrates, protein and fat metabolism. So what is role of laboratory in DM? In DM, applications of laboratory tests are as follows. Diagnosis of DM, screening of DM, assessment of glycemic control, assessment of associated long-term risks, management of acute metabolic complication. So first is laboratory tests for diagnosis of DM. Diagnosis of DM is based exclusively on demonstration of increased BSL, that is hyperglycemia. So current criteria for diagnosis of DM is typical symptoms of DM, that is polyuria, polydipsia, weight loss, and random plasma glucose greater than or equal to 200 mg per dl, or fasting plasma glucose greater than or equal to 126 mg per dl, or 2-hour post-glucose load value during oral glucose tolerance test greater than or equal to 200 mg per dl, or hemoglobin A1C greater than or equal to 6.5%. If any one of the above criteria is present, confirmation by repeat testing on a different day is necessary for diagnosis. So the test used for the laboratory diagnosis of DM are estimation of blood glucose and oral glucose tolerance test. So first, estimation of blood glucose. Since glucose is rapidly metabolized in the body, measurement of blood glucose is indicative of current state of carbohydrate metabolism. So when whole blood is left at room temperature after collection, glycolysis reduces glucose level at the rate of 7 mg per dl per hour. So addition of sodium fluoride maintains stable glucose level by inhibiting the glycolysis. Plasma is preferred for estimation of glucose since whole blood glucose is affected by concentration of proteins. There are various methods for estimation of blood glucose. In this, chemical methods are orthotoluidine method, blood glucose reduction methods using copper. Then in enzymatic methods, there is glucose oxidase peroxidase method, hexokinase method, then glucose dehydrogenase method. Then what are the terms used for the blood glucose specimens? So first is fasting blood glucose, that is sample for blood glucose is withdrawn after an overnight fast, that is about at least 8 hours. Then post meal or postprandial blood glucose. In this, blood sample is collected 2 hours after a subject has taken a normal meal. Then random blood glucose. In this, sample is collected at any time of the day without attention to the time of last food intake. So these are the some values of fasting plasma glucose and 2-hour post glucose values in normal, pre-diabetes and diabetes patients. The next is oral glucose tolerance test, that is OGTT. So glucose tolerance means ability of body to metabolize glucose, and in DM this ability is impaired or lost. So this test is recommended for diagnosis of gestational DM. So how the patient is prepared? So in this, patient should be put on carbohydrate rich unrestricted diet for 3 days. Patient should be ambulatory with normal physical activity. Absolute bed rest impairs the glucose tolerance. Then medication should be discontinued on the day of fasting. Exercise, smoking, tea or coffee are not allowed during test period. OGTT is carried out in morning after patient has fasted overnight for 8 to 14 hours. Then how the test is carried out. So fasting venous blood sample is collected in morning. Patient ingests 75 gram of anhydrous glucose in 250 to 300 ml of water over 5 minutes. So time of starting glucose drink is taken as a 0 hour. A single venous blood sample is collected 2 hours after the glucose load. So plasma glucose is estimated in fasting and 2-hour venous blood samples. Then second is laboratory tests for screening of DM. So what is aim of screening? To identify asymptomatic individuals who are likely to have DM. So early detection reduce subsequent complications. Screening for type 2 DM. In this, usually asymptomatic in its initial stages. So its onset occurs about 5 to 7 years before clinical diagnosis. So recommended screening test is fasting plasma glucose in all asymptomatic individuals greater than or equal to 45 years of age. If fasting plasma glucose is normal, that is less than 100 mg per dl, screening test should be repeated every 3 years. If it is greater than 126 mg per dl, test should be repeated on different day for confirmation of diagnosis. And if it is lower than 126 mg per dl, OGTT is indicated if clinical suspicion is strong. Screening of type 1 DM. So type 1 DM is detected early after its onset since it has an acute presentation with characteristic clinical features. Therefore, it is not necessary to screen for type 1 DM by estimation of blood glucose. Then third is laboratory test to assess glycemic control. So there is a direct correlation between the degree of blood glucose control in DM and development of microangiopathic complications. Maintenance of BSL as close to normal as possible reduces the risk of microvascular complications. So following methods can monitor degree of glycemic control. First is periodic measurement of glycated hemoglobin, that is HbA1c, to assess long-term control every 3 months. So what is HbA1c? It refers to hemoglobin to which glucose is attached non-enzymatically and irreversibly. Its amount depends upon blood glucose level and lifespan of red cells. Glycated hemoglobin is expressed as a percentage of total hemoglobin. So in normal, it is 4 to 5.6%. In increased risk of DM, that is in pre-diabetes patient, it is 5.7 to 6.4%. And in diabetes, it is greater than 6.5%. So target glycemic control is less than 7%. First results of HbA1c are seen in a decreased red cell survival, that is in hemolysis, blood loss, hemoglobinopathies, and splenomegaly. The second is daily self-assessment of blood glucose, that is SMBG. Regular use of SMBG devices by diabetic patients has improved the management of DM. With SMBG devices, blood glucose level can be monitored on day-to-day basis and kept as close to normal as possible by adjusting insulin dosage. SMBG devices measure capillary whole blood glucose obtained by finger prick and use test strips that incorporate glucose oxidase or hexokinase. Aim of achieving tight glycemic control introduces the risk of severe hypoglycemia. So daily use of SMBG devices can avoid major hypoglycemic episodes. Portable glucose meters are used by patients for day-to-day self-monitoring, physicians in their OPD clinics, and healthcare workers for monitoring admitted patients at the bedside. Then fourth is laboratory test to assess long-term risk. In this, first is urinary albumin excretion. DM is one of the leading causes of renal failure. So in type 2 DM, screening of microalbuminuria should begin at the time of diagnosis. And in type 1 DM, it should begin 5 years after diagnosis. Second is lipid profile. Abnormalities of lipid are associated with increased risk of CAD in patients with DM. So usual pattern of lipid abnormalities in type 2 DM is increased triglycerides, increased LDL, and decreased HDL. And the last fifth one is laboratory tests in the management of acute metabolic complications of DM. The three most serious acute metabolic complications of DM are diabetic ketoacidosis, hyperosmolar hyperglycemic state, and hypoglycemia. So in this, laboratory evaluation is blood and urine glucose, blood and urine ketone, arterial pH, blood gases, serum electrolytes, blood osmolality, and serum creatinine and blood urea. Thank you.
Next, I invite Dr. Pooja for the paper presentation. Dr. Pooja, are you there?
Yes, sir.
Okay, doctor.
Am
Please
I
share the
audible,
screen,
sir?
doctor. Audible, doctor. Audible. Please share the screen, doctor.
So previous had to shut down, sir.
Please retry, doctor.
Okay.
Sir, I'm unable to share, sir. Can you share?
Okay, doctor. 1 minute, doctor. Doctor, please start the session, doctor.
Good evening. Myself, Dr. Pujita. My presentation topic is on Basma Pariksha and their relevance. Next, sir. Derivation: Basma, Bas refers to luster or the shine. Sma indicates the past tense, means shining in the past or one which has lost the luster. Next. Introduction. Though these basmas are being used for centuries and are time tested, many a times they do not stand up in the national and international market due to the controversy regarding presence of free metals, toxicity problem, etc. Basma Pariksha is a set of Siddhi Lakshanas to access properly formed basma. Next. Procedures are 3. They are Shodhana, Bhavana and Marana. Next, sir. In Shodhana, what takes place is linear expansion, then the tension takes place, then the compression force. Then in the Marana, as the number of puta increases, the size of the particle decreases. Next. Basma Pariksha, they are physical and chemical. Rekha Purnata, Varitara, Nishchandra, Anjana Sannibha, Unama, Sukshmatva, Dantagre, Kacha Kacha Bhava, Vishishta Varnotpatti and Avami. In chemical, Apunarbhava, Nirutta, Nirdhuma, Gatarasatva and Amla Pariksha. Next. In Varitara, Mrutam Tarati Yettoi, Loham Varitaram Hitar. It is also called as Jalaplava. It should be present in all the prepared basma. The smaller the particle size, larger surface area, then floats on water. Next. Unnama, this is a reassessment test for the floating character of basma, indicates lightness of the basma. Next. Rekha Purnata indicates the minuteness and fineness of a basma. Particle size of 35 microunit is capable of lodging in furrows of finger. Next. Apunarbhava, detect any loose bondage in the compound after Marana. An unstable metallic compound can reduce to metallic state during this test. Next. In Nirutta, detect any unreduced or metallic portion remaining in basma is attracted towards the melted silver and will mix with it because silver has more affinity towards other metals. Next. Nishchandratva, a portion of basma should be rubbed in between the fingers and thumb, then examined under the sun rays. If there are any shiny particles, then it is not considered as a basma proper. Then this is not a common test for all the basma. It is only applicable for certain drugs, examples Varna and Abraka. Next. Avami, when the basma is consumed, a feeling of nausea or vomiting should not occur, indicates the acceptability of the basma into the system. This pariksha is specifically performed for Tamra, Tutta and Swarnamakshika basma. Next. Gatarasatva, the properly prepared basma attains tastelessness. It should not cause any tingling sensation. Example, Varatika basma. Presence of taste may be due to less heat and the presence of inorganic compounds. Next. Anjana Sadrusha Sukshmatva. Some portions of a basma is applied as anjana in the eyes, which are more sensitive, and it would be able to detect if a single particle of basma is above the required size. If any irritation is felt in the eyes, the basma should be subjected to more puta. This could be taken as a more sensitive and delicate test to determine the size of particles of basma. Next. Nirdhumatva. Some portion of basma is put on the fire to see whether fumes are coming out. This test is applicable for haratala and drugs containing gandhaka. If sulfur present in the basma, it burns, producing fumes. When heated, indicates that the marana is incomplete. Next, Amla Pariksha. Dropping on Nimbusva rasa or other Amla rasa. If basma not properly incinerated, it forms blue color. If metallic content is present, it might react with acidic nature and form some salts which have specific color. This is a specific test for Tamra, Swarnamakshika, Tutta basma. Next. Vishishta Varnotpatti. A specific color is mentioned for each basma. Next. Here Abraka, it is told as Ishtika Varna, Vaikranta Raktaba, Makshika Vimala Chapala, all these are Rakta Varna, and Kangshi Sudhavargiya Dravyas are Shveta, Kaparda Mrigashringar Krishna, Swarna is Champaka, then Rajata Tamra is Krishna, Loha Pakva Jambu Pala Sadrusha, Naga is Paravata, Vanga Shubra, Yashada is Pita. Next. Specific Basma Siddhi Lakshanas. Abraka, it has to pass Nischandra, Dantagre Kacha Kacha Bhava, Sukshma, Lochana Anjana Sanibha, then Tamra Makshika and Tutta, Avami Amla Pariksha, Kasisa is Avami Nisvadu, Haratala Nirdhuma, Dhatu Basma, Punarbhava Nirutta. Next. In nanosization technique, firstly the Bhavana, that is levigation, Mardana trituration, and Marana incineration takes place. Next. In nanosization, there will be increased absorbency, it is cell penetration and improved component solubility, then considerable dose reduction and enhanced bioavailability. Next. Significance, standardization of process of Basmikarana and establish a specific criteria for different Basma to indicate completeness of Marana, whether the prepared Basma will be acceptable to the body, assess the stability of Basma at physical and chemical level to avoid the adverse effect of Apakva Basma. Next. Modern parameters, organoleptic evaluation, physical, qualitative analysis, quantitative analysis, particle size assessment, structural cell shape study, toxicity study, and bioavailability study. Next. These are the parameters, EDX, TEM, EPMA, XRD, XRF, ESCA, extraction and chromatography, HPLC, NMR, IR, and MALDI. Next. Next. Discussion. Basma Pariksha are parameters to check the quality of Basma. Comparison of Basma Pariksha with modern tests. In our Ayurvedic, it is mentioned Varna, Gatarasatva, Mudutva, whereas in modern it is correlated to organoleptic tests. And Varitara, Unnama, and Rekapurna, SEM and TEM. Avami and Druta is correlated to XRF, Apunarbhava, XRD. These tests reveal the physical nature and chemical stability of the Basma, indicate completeness of Marana, and are necessary to perform before administering the Basma. Next. Conclusion. Various Basma Pariksha told in ancient texts are very simple and cost effective. After passing all Parikshas specifically given, the Basma can be used for therapeutic purpose. Ayurveda practitioners should perform these tests during their daily practice, thus reducing the untoward side effects and making people develop faith in Rasaushadhi, especially Basma. Rasa preparations retain therapeutic potency for a long time. It has a more shelf life and palatable and requires less dosage. Next. These are the abbreviation. Next. Thank you. Thank you all the organizers.
Next, I invite Dr. Suraj Campbell for the paper presentation. Dr. Suraj, are you there?
Yes, sir. Yes, sir.
Okay, doctor.
I'm there. So let me share myself. Dr. Suraj Campbell, sir.
Okay, okay, doctor.
Yes. Just a second, sir. Sir, can you visualize your image, sir? Hello.
Hello, doctor.
Sir, can you visualize your screen?
Okay, doctor. 1 minute, doctor.
Dr. Suraj Campbell.
Okay,
Hello.
doctor. 1 minute, doctor.
Screen is on, sir, or not?
I will share for you, doctor. 1 minute, doctor.
Right now, it's unable to open, sir.
Doctor, I will share for you, doctor. Please start, doctor. Is this your screen? Is it visible, doctor?
Yes, sir. Yes, sir. Good evening, sir. My name is Sir Vaidya Suraj Vasan Kame, designation PG scholar, sir. Second year Criteria, college name, sir, Ashwin Rural Ayurvedic College, Manchil, Sangamne, sir. Name of my guide is Dr. Vinod Jadhav, sir. Assistant Professor, Criteria Department, College Ashwin Rural Ayurvedic College, sir, Manchil, Sangamne. Email ID, sir, Suraj Kame, 8985, gmail.com. So my aspect is skin disease and skin problem and are increasing nowadays because increasing pollution and decrease in ozone layer. Sunrays are also responsible for skin disease and also nowadays lifestyle is also becoming major threat for skin disease. There is increase use of chemical and hybrid food habits. To overcome all this problem, only Ayurveda has a solution because it has a grand knowledge of skin disease. Skin disease skin disease might be acute or chronic. So there are various factors which are responsible for skin health and illness. In today's era, people are sometimes tend to take unnecessary medication, which sometimes creates chaotic skin eruption, frequently known as a drug-induced dermatitis. So these are the series of diseases which are taken under the name of eczema in general. In Ayurveda, all the skin-related disease disorder are covered under Kushta. So in the Ayurveda, there are different types of Kushta mentioned, mostly divided in Mahakushta and Shuddha Kushta. Overall, eczema patient prevalence difference from 8.75 to 18.1%, sir. According to Ayurveda, all the Kushta are three uses that is from Rasadhatu to Ambulasika meditation. Like Ayurveda says, Hetu is the utmost priority which comes to in every system. It's Vihar, Ahar and Vihar, system, Guru, Snigdha, etc. Cause acute and chronic separation of system. Unexpected. And management of the of English, pathology, and can increase the strength of that guru being other and master stomach that Shada Guru eczema, kushta, sanskar, dermatitis, and drug induced. Next is sir. Okay, so put a 25-year-old female patient who is avoidable by occupation came to a period of Khalitya Department of Hospital, Surve College and Hospital. The chief complaints of a Dahamuk Pradeshi, burning session at facial region, Kondumuk Pradeshi, itching at facial region, morning neck, Arapta, rubor, facial dryness and cry, 5 days, and Mukadushika pimples over face 2 to 3 months back. So no history of HTM, DM, asthma, jaundice, hepatitis, thyroid, PCOD, and urticaria. Patient had a recurrent episode of Amla Pitta as inquired. So no any major illness recorded as per patient, strong sensitivity recorded now, or not any allergic to any drug or food till now. Next, list of present illnesses that a patient was fine before 2 months. Then starting the abscess symptom for which she recovered multiple antacid. Then she developed acne over face in the past 1 month and a half of her which she took a multiple treatment like homeopathy and allopathy. 8 to 10 days back, she had a burning sensation in urine for which she received Uritoc, neutrophurination. And after receiving this tablet, she developed itchiness in the body and facial region. And after that, she received 2 tablets suffixing by hospital doctor. After 1 day, she developed uritis over a face and severe dryness over facial region. So which brought her to us for a further treatment. Next picture. Past drug history was the tablet Uritoc 100 mg and tablet cefixime 200 mg for BD and tablet antacid also for 2 tablespoons for BD. So no past history of intake of OCP. Some menstrual is 5 to 7 days, irregular 2 pads a day, glycation 20 to 80 painful. Next. रुग्ण परीक्षा नाडी 80 per minute and मलोस्तंभ मूत्र अल्पदाह जीवाटंग अल्पसाम नेत्र श्वेतदाब शब्द वॉइस अविश स्पर्श स्किन क्वचित उष्ण आकृती बिल्ड कृष्ण बल मध्यम बीपी सर 115/75 mg प्रकृति अग्नि वैषम. Next. Local examination is a pleuritis over facial region involving both cheeks, forehead and chin. Triascaral lesion on the cheeks and chin. Flow over chin and forehead. Hyperpigmentation of the skin. Next pic. ESI scoring, sir, it is a body region and head and neck. So body region Head and neck is 2% redness, and head and neck is thickness for 1, and scratching is 1. Lichen of acid is 0. So severity score and area score is 3, and multiple is 12:5, and region score is 1.2. Severity score is 2 plus 1 is equal to 0 plus 0 is equal to 4, sir. So area score is considering both cheeks involvement is 70% each, which is a total 34%. Scalp involvement is a 10%, sir, and total is 34 plus 10 is a 44%. So which fall under score is a 3, and itching grading on scale is of 1:10 is equal to 7, sir. Next, sir. Systemic evaluation, all systemic evaluation were within the normal limit except unknown sources, because unknown sources the anorexia sometimes decreases, sometimes bloating and reflux of food, sometimes in a mouth, sir, and Purisha sources the malus stomach. Next slide, sir. Reflexes are DTR and RTN, left means right and left. AG is NAD, left is NAD. BJ is NAD, sir, and left is NAD. TJ is NAD, sir. LT is NAD. KG is NAD, sir. LT is NAD. Plantar is also NAD, sir, and left is NAD, sir. Next slide. Material and methods are the methods of case study. Center of a study, ITT Sopida, Boston Rural Ayurvedic College and Hospital, Manchi, Sangamner. Material is a Shatagrut is given for local application for 2 times per day, which is taken from GMP certified company with reference of a charak. Mode of application is P-shape or adequate amount is taken, which is sufficient to cover the special areas. Next. This is a picture of a before pre-treatment and a post-treatment. There is a result in changing that the pigmentation is lighter and the curing skin surface. The discussion is at Hetu. Ahar is a Pittakar ahar, oily, spicy food, junk food. So we are in shift-wise duties like night duties. Aushadhi is a modern drug and homeopathy before taken. Samprapti Ghatik is a dosha pitta and vata. Dushit ras rakta, srotas is a rasva, rakta, annava. Ubhavasadhan is a facial region, sir. Udbhavasthan is a facial region. Adhishtan is bhajak pitta and rakta. Vyakastan is a tvaka. So according to mode of action of Shabdatu Gurut is exam is distressing to person. It leads to many day-to-day restriction to patients, sir. Next slide, sir. Pathophysiology is a key Ayurvedic aspect. According to Ayurvedic aspect, due to Pittar ka ahar and vihar, the agni get viated. Her Ushna Tikshna gun of Pitta is increased along with the Ruksha gun of Vayu. Such viated Vat and Pitta also viated the cup and lead to a Vicharika like condition, Viracharika like condition. First Pacha Pitta gets viated, which severe as Agni to all rest of 4 Pitta, and Bhaja Pitta, which is at the level of the skin, get affected. So due to Dosha Rakta, Pitta and Vayu, due to Pitta and Rakta is present. So according to modern view, patient is allergic to some drugs and which give rise to adverse drug reaction. So in such condition, immune mediated reaction gets started with mediated in the 3 phases of eczema. Acute phase there are the 3 phases. For acute phase, subacute phase, and chronic phase. In acute phase, the skin is inflamed and spongiasis. Intracellular edema take place more and more, which leads to scratching and eventually rupture of the intracellular attachment and form vesicles. Subacute phase is a sponginess and vesiculation is diminished. So there is an increased ascendance which is associated with formation of parakaryotic horny layer, and which often contain less of the coagulated plasma and pancreatic nuclei of blood cells. So chronic eczema is a hyperkeratosis takes place on behalf of parakeratosis. Keratosis is more prominent than spongiasis. Next question. Probable action of a drug. So according to Samanya Gun of Guru, so Ras is a Madhur and Gun is a Somya Mrudu. Virya is a Shita, Vipak is a Madhur, Prabhav is a Vishagana Rakshina Vyapastaka, Doshaganata is a Vata Pitta Prashama, Karma is Agni Dipak Rusha Medha, Rog is a Udavarta Unmat Asmad Stool Jewel. So Shatala growth is a wash with water 100 times, which enhances its regenerating properties. Research shows that it increases proper amount and moisture content of the final product as compared to normal growth, so which is more biologically absorbable. So due to excess Shitavirya and the properties, and also by Prabhav, it suppresses the Vatana Pitta, which is ultimately give rise to cooling effect. However, the Shatagrowth is expected to act in a subacute phase of eczema where excess ascendance is taking place. So it is not also stops the sponginess by its immunomodular action and Rakta Shodhan if combined with other Rakta Shodhan dravya, but also expected to hamper down the parakaryotic horny layer production, sir. Next picture. On conclusion, on the basis of the above discussion, can be concluded that the Shatagrut and a preparation like that can be useful in the various schemes such as eczema. So here it will work well on inflammation, excessive dryness of skin, being growth preparation, it acts on the burning like condition. So also Granthakar as mentioned, it is used with various in various conditions like visarpa, wound, daha, and skin condition, etc. So here it acted by the Madur and Vata Pitta Shamak activity. It also contains copper ion, which are act as an antioxidant and maintain skin health. There is a reduction in the pain, burning, and Ayurapta. Next. So that is all references. That's it.
Thank you, Dr. Siraj Campbell.
Yes, sir. Most welcome.
Today's presentation seems to be over. Except for the minor network problems of some participants, everyone presented very well. Today's presentation ends here now. The rest of the presentation will begin tomorrow at 6 p.m. On my behalf and the behalf of Ayurapta organization, I thank all those who have cooperated with us. I would like to invite Dr. Aishwarya to conclude the session.
Thank you, Dr. Sabin. So this is the end of our today's presentation. And may I take this opportunity to congratulate all our participants for their wonderful presentation. And on behalf of Ayurapta, I would like to thank our panel members for their support. And we'll meet you tomorrow